So good morning, everyone. Welcome to the Subcommittee on Health, which will now come to order due to COVID-19. Today's hearing is being obviously held remotely. All members and witnesses will be participating via video conferencing. As part of our hearing, microphones will be set on mute to eliminate background noise, and members and our witness, you'll need to unmute your microphone each time you wish to speak. Documents for the record should be sent to Megan Mullen at the email address we've provided to your staff, and all documents will be entered into the record at the conclusion of the hearing. The secretary, as I said, has a hard stop at 2 p.m. Eastern Standard Time, so as I just mentioned a few moments ago, I'll have to enforce the 5-minute clock to ensure there's enough time for all subcommittee members to ask questions. I know that there are full committee members that are joining us today. I hope we have time for you to ask questions. We'll do our best, but the subcommittee members will obviously come first. So the chair now recognizes herself for 5 minutes for an opening statement. Welcome, Secretary Becerra. You are so welcome here, and we wish you every success as you succeed in leading HHS. The American people will succeed. The secretary and I are classmates. We came into the Congress at the same time. And Mr. Secretary, you've inherited a position with enormous responsibilities, especially as our nation recovers from COVID-19. I think you're already making progress. HHS and the Biden administration have administered over 200 million COVID-19 vaccine doses and are on track to vaccinate 70% of American adults by the 4th of July. That would be a new kind of celebration of the birth of our country. New COVID-19 cases are thank God, at a 7-month low. We're seeing children safely going back to school, states reopening, and some normalcy returning. The Biden administration has moved quickly to reverse the damage done to our healthcare system by the previous administration, enrolling over 1 million more Americans in the ACA health coverage and reversing the draconian cuts to in-person enrollment help, rescinding the approval of several states' unlawful Medicaid work requirements, ending the discriminatory public charge rule, which would have penalized people for legally using healthcare services such as Medicaid, returning the U.S. to the World Health Organization, protecting women's health by proposing regulations to end the Title IX gag rule, as well as ending the global gag rule, and ending discrimination in healthcare based on gender identity or sexual orientation. These actions are in addition to quickly and responsibly distributing the billions of dollars in emergency public health funding provided through the American Rescue Plan. President Biden's fiscal year 2022 budget request continues these achievements by helping American families rebuild from the COVID-19 crisis healthier and safer than before. The budget request addresses the systemic failures revealed by the pandemic by restoring and expanding public health capacity by providing the CDC with its largest budget increase in 2 decades, in 20 years, supplying $1.6 billion for the Community Mental Health Services Block Grant, more than doubling our nation's mental health funding. That's an issue, Mr. Secretary, that every member of this subcommittee has spoken to and worked on. Investing $10.7 billion to end the opioid crisis after last year's tragic record high number of overdose deaths, another bipartisan issue, and addressing our nation's racial health disparities by increasing the Indian Health Services budget by $2.2 billion and making major investments at the CDC to reduce maternal mortality, especially for Black women. Importantly, the president's request also provides $6.5 billion to launch the Advanced Research Projects Agency for Health, ARPA-E, which holds the promise for transformational advanced biomedical research. I very much look forward to hearing more about this today, about what the administration envisions for this agency. But there's still so much more to do. I think there always is. Our national security is at risk because our dependence on foreign manufacturing for medical supplies and pharmaceuticals continues. We're unprepared for the avalanche of patients who will need care for chronic long COVID. We still don't have an effective or easy to access treatment for COVID-19. And our nation continues to face stark and persistent racial disparities in health coverage, chronic disease, and mortality. So we have a lot more work to do, Mr. Secretary. We look forward to working with you to develop a budget and policies to improve our nation's health and well-being. We thank you for being with us today. The chair now recognizes the ranking member of our subcommittee, the gentleman, Mr. Guthrie, for his 5 minutes for an opening statement.
Thank you, Chair Eshoo, for having this important hearing, and thank you, Secretary Becerra, for being here today as we examine the fiscal year 2022 Department of Health and Human Services budget. I was alarmed to see the amount of spending that the administration believes we can afford after reviewing the Biden administration's skinny budget. In total, the proposed budget is more than 8% increase over the amount appropriated for fiscal year 2021. This increase would be on top of the nearly $4 trillion Congress has already allocated for the COVID-19 pandemic in the first 5 COVID-19 relief bills. I supported these relief bills that were focused on providing needed COVID-related assistance for our country. $1.3 trillion of this funding has yet to be dispersed from relief packages. That doesn't include the $1.9 trillion recently authorized from President Biden's COVID-19 package, which only 9% goes towards fighting the virus. The HHS budget proposal in front of us today grows HHS by almost a quarter, with $131.7 billion included in the $1.5 trillion fiscal year 2022 budget. I agree we need to improve public health infrastructure and better prepare for future public health emergencies. However, as we work on these improvements, we also have the responsibility to be good stewards of taxpayer dollars. We have seen firsthand how public-private partnerships, such as Operation Warp Speed, have allowed this country to get vaccinated and reopen months ahead of our peers around the world. I hope we can work across the aisle to fully evaluate the programs that need support and allocate funds wisely. There is no doubt that we must continue to increase funding for the National Institutes of Health. In fact, Republicans have worked with Democrats to increase funding for NIH each year over the past 5 years. As we look at the budgets of federal agencies that help with COVID-19 response efforts, we need to assess any increase in the context of their performance. I specifically want to mention my strong concerns with certain areas of what we know of the proposed budget. First, I am pro-life. I believe in protecting the unborn. I am very concerned with President Biden's comments on removing the Hyde Amendment. Hyde has been around since 1976 and agreed upon for both Republicans and Democrats for its inclusion in appropriation bills for years. I strongly disagree with removing this protection and allowing taxpayer dollars to fund abortion procedures. Secondly, I'd like to speak with the current crisis at our southern border. Last Congress, I served as ranking member of the Oversight and Investigation Subcommittee. The subcommittee held hearings on the management, care, and treatment of unaccompanied children. At that time, U.S. Customs and Border Patrol was experiencing a record number of encounters with unaccompanied children. And as a result, the Office of Refugee Resettlement was experiencing record numbers of referrals. Since President Biden has taken office, there's been a rush of migrants arriving at our southern border. CBP and ORR are experiencing even higher numbers than it did in 2019. According to CBP data, starting in January of this year, the number of UCs and single minor land border encounters each month has been higher than the numbers were during those same months in previous years. As of May 2nd, 2021, there were over 22,000 unaccompanied children in ORR's care. As a result, ORR has had to open several temporary influx care facilities and emergency intake sites, but has yet to open one of the temporary influx facilities that the Trump administration kept in a warm status to quickly stand up for surges in UC referrals. Further, there have been reports of thousands of migrant children being kept in overcrowded Border Patrol facilities for longer than 72 hours. I joined several of my colleagues on this committee to request information from the Biden administration on capacity issues, allegations of abuse, and COVID-19 protocols. While we received responses to some of the questions yesterday, we await answers on the rest. The Biden administration must get a better grasp on handling this crisis and the massive influx of UC referrals. Secretary Becerra, I appreciate you being here today and appreciate our phone call yesterday. And I look forward to hearing your testimony and responses to important questions from my colleagues. And I yield back my time.
The gentleman yields back. The chair now recognizes the chairman of the full committee, Mr. Pallone, for his 5 minutes of opening statement. I'm sorry. Good to see you, Frank.
Thank you, Chairwoman Eshoo. This is obviously a very important hearing, and it's really great to see our new secretary, who is one of our colleagues and a former member of the Democratic leadership, Javier Becerra. Great to see you, Javier. At last year's hearing with the Trump administration, Democrats highlighted the implications of massive cuts that were being proposed to vital health programs, while simultaneously hearing federal witnesses attest to the terrifying potential of the then new virus known as COVID-19. The Biden administration's fiscal year 22 budget request is comparatively a breath of fresh air, and we can now bolster our nation's public health agencies by acting on this request. I heard Mr. Guthrie express concern about the increases, but I believe, given the pandemic, I think these increases are absolutely necessary. Overall, the request includes $131.7 billion for HHS and its adjoining agencies, a 23.5 increase from the 2021 enacted level. This includes critical investments to improve our nation's public health preparedness, such as $905 million for the Strategic National Stockpile and $8.7 billion for capacity improvements and public health threat detection and assistance at the Centers for Disease Control. If enacted, this would be the largest budgetary increase for CDC in nearly 20 years. The request also includes funding for vital safety net programs and for addressing health inequities in COVID-19 and beyond. It increases funding for CDC's social determinants of health program. It aims to reduce maternal mortality and morbidity through strengthening maternal mortality review committees, and provides a funding increase to the Indian Health Service, very important to many of our members on this committee. It also provides an 18% budget increase for the Title X Family Planning Program, and this program has historically served over 4 million low-income people a year by providing critical screenings and health services. Now, the Biden administration's budget request would also expand cross-agency research capabilities to combat life-threatening diseases. Through the National Institutes of Health, it would establish the Advanced Research Projects Agency Health, or ARPA, a research agency that would initially focus on diseases such as cancer, diabetes, and Alzheimer. I look forward to learning more about how the proposed agency's activities may build off NIH's existing research to fight life-saving cures. I know the president talked about this in his address, Mr. Secretary. And lastly, the budget request also makes significant investments in improving mental health and combating the opioid epidemic. It would provide a $1.6 billion to the Community Mental Health Services Block Grant and $10.7 billion to fight the opioid crisis, which has been exacerbated, as we know. We've had hearings on this, Madam Chair, by the COVID-19 pandemic. Now, these investments are bold and necessary, but we can't stop there. The COVID-19 pandemic laid bare the impacts chronic underfunding of public health has had on our surveillance, preparedness, and response efforts. And it's my hope to work with the Biden administration to ensure rebuilding our public health infrastructure is a key component of any jobs and infrastructure plan. And we also have to take action to lower the cost of prescription drugs. The president mentioned it in his address, by passing H.R. 3, the Elijah Cummings Lower Drug Costs Now Act. And we have to make permanent the enhanced premium tax credits that we enacted into law on a temporary basis in the American Rescue Plan. The administration recently announced that nearly 1 million Americans signed up for health coverage during the special enrollment period, and the enhanced subsidies are reducing monthly premiums by over 40%. Thank you again, Secretary Becerra, for really pushing that special enrollment period. I know how important it is to you. We also have to ensure that low-income Americans have access to quality, affordable coverage, and now is the time to finish the work we began over a decade ago with the Affordable Care Act. Now, I just wanted to say this. I heard Mr. Guthrie mention ORR and the southern border and the unaccompanied children. You know, I have to be critical, Mr. Guthrie, because you somehow suggested that, you know, that the Trump administration played a positive role in this. Maybe that's not what you meant, but it sounded that way. And I have to say, after having gone through 4 years with the Trump administration, which forcibly separated children from their families, caused terrible damage to not only the children, but to the ORR program itself, I cannot see anything positive that came out of that. You know, during the time that they were in charge, the Republicans on this committee refused to even hold a single hearing to examine what was happening and hold the Trump administration accountable for their outrageous actions. So, you know, the Biden administration was left with this decimated system, but they're working hard to process those children humanely. And thanks to you, I know we are going to hold a hearing within the next month in our Oversight and Investigation Subcommittee, where the head of the ORR will testify and will examine how the ORR program is functioning. I like to be bipartisan, but I can't excuse the Trump behavior on this. And I think the Biden administration is doing their best to deal with what was left in a terrible situation. Thank you, Madam Chair.
The gentleman yields back. The chair now recognizes the ranking member of the full committee, Representative Kathy McMorris Rogers, for her 5 minutes for an opening statement.
Thank you, Madam Chair. Good morning, everyone. Just very quickly on the border, under the Trump administration, there was action taken very quickly to get more money, to actually get the border under control, to get families back together, to get more judges in place so that we could secure our border and also help those that were knocking on our door. And I believe that this needs to be a priority now. Unfortunately, the crisis at the border is being ignored by the current administration. And I know we're going to work on that some more. This committee has been at the forefront of this issue. Today we have Secretary Becerra with us, and I wanted to join in saying congratulations. I too served with Secretary Becerra in the House of Representatives, and I look forward to working with you in this new position. Certainly, as Secretary of the Department of Health and Human Services, you're at the forefront of a critical time in our nation's history, and as we turn the corner on the pandemic. And really thanks to the historic innovation of the private sector and the Trump administration's Operation Warp Speed, we are delivering fast and effective and safe vaccines to millions of Americans. And it's something that we came together to accomplish, and it's an American success. We hope that your leadership will provide clear and consistent evidence-based guidance as we reopen, including 100% of our schools, and bring optimism to America again. Mr. Secretary, after a year of lockdowns, fear, isolation, too many in our communities are battling the deaths of despair. Our communities are seeing record high overdose deaths. Mental health emergencies have increased. We know the pandemic and top-down government decisions from lockdowns and school closures, unfortunately, have made it worse. It's going to take our nation's best and brightest in local communities, doctors, the private sector to fix these problems and deliver solutions that families desperately need and want. We have broken families, we have broken systems, and we must address it. Unfortunately, socialized medicine, a government-run healthcare system, is not the solution. It will only lead to it won't lead. It won't lead to personalized care. We need personalized care for every individual, every person to have a chance for a better quality of life. I'm concerned about so many that have continued to advocate for a single payer system and socialized medicine. Medicare for all, centralized government healthcare is full of empty promises. This is the reality. Rather than provide certainty, it kicks roughly 180 million people off their employment-based plans and significantly raises costs. Rather than modernize our healthcare system to empower patients to catch up to the 21st century, Medicare for all would take back the clock to an outdated, politically influenced government takeover of our healthcare system. Just like Speaker Pelosi's drug price control scheme, single payer will destroy innovation for new cures and breakthrough medical treatment. It will also limit access. CBO reported, quote, public plan might not be as quick to meet patients' needs such as covering new treatments. That's CBO. My colleagues and I aren't going to accept the empty promises of socialized medicine. I'll take freedom over empty promises for free stuff any day of the week. There's too much at stake as we crush this pandemic, fight the deaths of despair, and build a new future for a modern healthcare system. We should be taking action to make sure that people can make the best decisions for themselves. And I did want to address the border crisis. Illegal border crossings remain at a 20-year high. More than 22,000 children are in facilities right now. This is a record. We need to hear what we're going to do to slow this down. And in many cases, the administration, unfortunately, has been silent. We need accountability. We need to have answers. I appreciate you being here today. From the immediate crisis at the border to the long-term crisis that will result if we don't modernize our healthcare system, bring price transparency, empower individuals, empower patients. That needs to be our goal. So thank you again for joining us. I hope this is an opportunity to work together to build trust and to really focus on the American people and the best healthcare system in the world. With that, I yield back.
The gentlewoman yields back. I now would like to introduce our witness. In so many ways, he doesn't need an introduction because so many of us know him well. But let me just say that Secretary Becerra is the 25th Secretary of the Department of Health and Human Services. He previously served, just before he came back to DC as the Secretary, served as the Attorney General of the state of California, the second largest department of justice in the country outside of the DOJ in Washington, D.C. And he served very importantly for 12 terms in the United States House of Representatives. And we're all very proud of him. We're very proud of you, Mr. Secretary. So welcome to the subcommittee. You are no stranger, obviously, to the House. While you were not a member of the Energy and Commerce Committee, you were part of the tax writing. So you did the tax work, we did the big policies, and it's really great to see you. As I said, to the extent that you succeed in leading this agency, the nation will succeed. So we want to work with you to ensure that. So you're now recognized for your 5 minutes of opening statement. You look great, and take it away.
Chairwoman Eshu, Ranking Member Guthrie, and members of the committee, first, great to see so many familiar faces, and thank you for the opportunity to appear before you to discuss the President's 2022 discretionary HHS budget. The COVID-19 pandemic has shed light on how health disparities and the lack of national coordination and funding can leave us vulnerable to crises. Now more than ever, we must ensure that HHS has the resources to achieve its mission and protect the health of our communities. The budget President Biden has put forward is targeted and forward-thinking to meet department goals. For HHS, the budget proposes $131 billion in discretionary budget authority. This $25 billion increase from fiscal year 2021 underscores the administration's commitment to prepare the nation for the next public health crisis, to address disparities in healthcare, and to support our state and local partners, and as well to invest meaningfully in behavioral health, among other very important priorities. To start, the budget provides $905 million for the Strategic National Stockpile, which has served a critical role in the COVID-19 response, but is in need of upgrading. The budget also makes the largest investment in CDC in almost 2 decades. With these 2022 investments, CDC will address preparedness within the United States and strengthen global health security. As we continue to confront new and emerging COVID-19 variants, as well as an accelerating surge of cases in places like India, support for CDC's work is ever more important. Madam Chair, the budget provides funding increases to address violence in our communities. $489 million to support and protect domestic violence survivors, and $66 million to support victims of human trafficking and torture. Gun violence, very much a public health issue, is addressed by doubling both CDC and NIH funding for firearm violence prevention research. And to ensure that HHS is equitably serving all Americans, the discretionary request invests over $200 million to reduce maternal mortality and morbidity, which disproportionately affects women of color. It funds a range of rural healthcare programs and expands the pipeline of rural healthcare providers. It includes a $2.2 billion increase and advance appropriations for the Indian Health Services. The budget increases funding for Title X family planning programs to improve access to vital reproductive and preventative health services and to advance gender equity. To help build the best possible future for our children, the budget provides $19.8 billion for the department's early care and education programs, including $11.9 billion for Head Start and $7.4 billion for the Child Care and Development Block Grant. The budget also invests in improving the child welfare system, particularly to address racial inequity. The President's budget also takes action to address the epidemic of opioids and other substance use, investing $10.7 billion across HHS and increasing access to medications for opioid use disorder and expanding the behavioral health provider workforce, particularly in underserved areas. And in a notable investment, the budget provides $1.6 billion to the Community Mental Health Services Block Grant to respond to the systemic strain on our country's mental health care system. To support innovation and research, the budget increases funding for NIH by $9 billion, $6.5 billion of which will go to establish the Advanced Research Projects Agency for Health, ARPA-H, with an initial focus on cancer and other deadly diseases. This major investment in federal research and development will speed transformational innovation in health research and speed application and implementation of health breakthroughs. HHS plays a critical role in promoting the well-being of those who come across our border seeking refuge. The budget reflects that commitment by increasing funding for the Office of Refugee Resettlement to rebuild the resettlement infrastructure and ensure unaccompanied children are safely cared for. Finally, given the magnitude of HHS's work and the taxpayer dollars that are used to fund it, it is critical that we ensure our funds are used appropriately. The discretionary request invests in meaningful oversight and accountability, including efforts to combat fraud, waste, and abuse in Medicare, Medicaid, and private insurance. I want to thank the committee for inviting me to discuss the President's FY 2022 HHS budget, and I want to thank the staff at HHS for their Herculean effort in fighting COVID-19 and protecting the health of their fellow Americans. To build back a prosperous America, we need a healthy America. President Biden's discretionary request builds on that vision. Madam Chair, thank you.
Thank you, Mr. Secretary. We'll now move to member questions, and the chair recognizes herself for 5 minutes. You mentioned ARPA-H, and I'm glad that you did. The president's budget contains $6.5 billion in it to create this new independent agency. Tell me what you what the rationale is to have this in NIH. This is modeled on DARPA and ARPA-E, and it doesn't seem to me that as extraordinary as NIH is and the work that they do, that successful independence that is the imprimatur of DARPA and ARPA-E is really there. So that's my, I know that you support the sub-agency, but if you could comment on where you think it needs to be. Two other things. Our subcommittee was the first in the Congress to have a hearing on long COVID. We had powerful testimony, Mr. Secretary, from patients. When I asked both the CDC and NIH, because they both testified, when I asked them who was leading the coordinated whole of government response to what is taking place with long COVID, we were told there was no such leader or coordinator at HHS. So we need you to tell us what you're going to do about that. We need a coordinated response from the government, and we need someone to lead that. On the $6 billion provided for HHS for therapeutics in the American Rescue Plan, I think that we need a strategy for supporting the development of an effective therapeutic. It's been over a year since the pandemic has visited us, and the current monoclonal antibody therapies on the market really have not been as successful as we'd hoped. But newer monoclonal antibodies are being developed that could be delivered outside of a hospital setting, which is really important, and I think could be effective against variants. So I'd like you to tell us how you're going to spend that $6 billion. And on the provider relief fund, I think maybe someone mentioned that in their opening statement. I think that the Trump administration failed at managing this. The money went out too slowly, and it wasn't a transparent process. So can you clarify for the subcommittee how much money remains in the provider relief fund, and when you plan to disperse it? And is there a priority order for who receives it next? And my last question is, I think that we need more resources in the FDA for inspections, both domestic and foreign. The foreign inspectors, actually, their work is voluntary. And I think that we have a long, long way to go on this. The American people depend on these inspections. Look what happened at Emergent. I mean, it's a national disgrace. So those are all my questions, Mr. Secretary, and you have 2 minutes to answer. And if you can't answer all of them, of course, you'll respond in writing. So welcome and thank you.
Madam Chair, thank you. I was actually going to take 2 minutes to just say thanks for having me and great to be with you. So I'll try to cut that out and go right to the questions. First, on ARPA-H, Madam Chair and members, I think what President Biden is saying is, we know what basic research can do for us. It leads to some of the greatest scientific discoveries, but sometimes we got to move it faster, because for some people, contracting a disease is a death sentence, and it's a quick death sentence. So what President Biden has simply said is, let's accelerate this. If we something innovative, something promising in the works, let's jump on it. And I applaud President Biden for wanting to devote energies. We can't do it with every particular condition or disease, but we can focus. You mentioned cancer. We talked about some of the deadly diseases. We can name any number of them. But what he's saying is, we're going to partner with the private sector.
But where do you want to put it? What's your view as to where this should be?
Well, we know that NIH continues to do the basic research. I think we have any number of places that we could feel comfortable with it, but NIH continues to do the basic research. If we want to just lift that up and launch faster, we can discuss that. But the important thing is that we launch and not let issues about bureaucratically where we're going to locate ARPA-H get in the way of a great idea, because there are communities out there clamoring for us to help them find that next discovery that keeps their loved one alive. Should I move on to some of the other questions?
Please, as quickly as possible.
Sure. COVID response by HHS. Here I will tell you, Madam Chair, that we are fortunate to have the experts who know this, whether it's CDC, at FDA, NIH, and with the president's team working on this as well. We are coordinating, but everyone is at the helm. All hands are on deck. I can tell you that you don't put more than 200 million shots in arms in a little over 100 days if you're not coordinating, working together. And so at HHS, we have a team that will continue forward, working closely with the president. This is the priority, is making sure we beat out the COVID-19 virus.
Well, my time has expired, Mr. Secretary. Thank you again. It's great to see you. And the chair now recognizes Mr. Guthrie, again, the ranking member of our subcommittee, for his 5 minutes of questions.
Thank you, Madam Chair, and thank you, Mr. Secretary, for being here. And we did have hearings on the border before, and ORR before us. As a matter of fact, when we had the professionals before us, they said that the position really changed at the border. The situation got so much better after Congress finally passed the supplemental bill. And the supplemental was asked for I don't have the numbers in front of me because I didn't prepare for this line of discussion, but the supplemental sometime in mid-spring was asked for by the administration. We didn't pass it as sometime in mid-summer. I do not know that for a fact, with the majority of Republican votes, and the people who had the biggest concerns in the hearing voted against the supplemental. So I just want to set that record straight. But we did have your predecessor before us, Mr. Secretary, and matter of fact, there were some very passionate discussions from colleagues on the other side of the aisle, to the point when he got up and left, I said, who in the world would want to take one of these jobs? And so I was going to say, I'm going to treat you with respect, and because your office deserves it and you deserve it as a person. So I appreciate that. But just because I'm doing that doesn't mean I'm less passionate about what's going on at the border today. And I just want to talk about, there was an article, I guess it was in Texas investigating abuse allegation at a migrant facility. It's the migrant facility in San Antonio that's holding over 1,600 unaccompanied children, and the allegations of sexual abuse, insufficient staffing, children not eating, and tested positive for COVID, not being separated. And I know you're aware of that. I just want to say, has ORR investigated these allegations? And if so, what can ORR share about these allegations? And have you had the opportunity to visit an ORR facility? I know I've had the opportunity to do so. And if not, when you plan to do so. But so the allegations, and if they've been investigated, would be the first question.
Congressman Guthrie, thank you very much for the question. And thank you also for the manner in which you've asked the question. I appreciate that. We are absolutely on top of any reports, any allegations of abuse. We take our role very seriously of making sure that not only do we follow the law when it comes to the care of these migrant children, but that we provide them with the well-being that they deserve while they're in our custody, temporary as it might be. And we don't get into the discussion about their immigration status, whether they're going to be sent back home or not, but we make sure we take care of them. So any report, we will investigate. And we continue to do that. But what I can tell you is the several thousand children that have come through our custody are all being cared for and cared for well.
Thank you. I think they were before, once they got into the ORR facilities. You have some professionals there that are outstanding, and they really worked hard and did a really, really good job. So switching to drug pricing, we're all want lower drug pricing. All Americans want lower drug pricing. You know, the president said in the State of the Union, as we talked about, that if we can't agree on everything, let's at least pass the things that we agree on. We have a bill, HR 19, that has 36, I think, unanimous bipartisan bills that will make an effect on drug pricing. Some people say it's small ball. It's not. If you reform Medicare Part D, it's every American over 65. And so what we want to ask the question is, one, can we not proceed on areas in which we agree, which would be HR 19, that does make a difference? And if we go with HR 3, we had a hearing the other day, and the witness on the Democrat side kept talking about it would just be 10 to a dozen bills, and bills that have been around, I mean, pills or drugs that have been around for a long time. And therefore, we really wouldn't affect innovation because they've been around for a long time. But we all know that in any business, you take your previous revenues and put them into your research to move forward. So I do think that was very dismissive of the problem of HR 3 could cause and moving forward. So one, can we not work together on what we agree on? And two, if HR 3 is part of a package, let's hope it's not going to be paid for other priorities. For instance, these are people's premiums, people's payroll taxes that they put in. We want to make sure that money, can you commit that money will stay in Medicare?
So Congressman, let me first agree with you. We need to work together. And I hope that you will test us at HHS if you need technical assistance, if our team can be of any service in helping you noodle through a particular issue as we try to tackle what I think every American agrees with, and that is that we have to lower drug prices. Then hopefully we'll not only will the working together produce results, but we'll do it quickly. And so I can guarantee you that if you give us an assignment, we'll take it on. And if you give us dollars to make it happen, we'll keep that money where it's supposed to stay. We will follow the law. Whatever you all decide to pass, we will implement it and make sure we comply with whatever the prescriptions are within that legislation that you pass and have become law.
We only have 10 seconds. So would the administration not want the Medicare money to stay in Medicare? If we
want to make sure
Yeah.
we certainly want to make sure that we're improving Medicare. And so we'll look at what you all send us to make sure that we can not only improve Medicare, but make healthcare better for all Americans.
Thank you. Thank you for being here and thank you for your testimony. And I yield back.
The gentleman yields back. The chair is now pleased to recognize the chairman of the full committee, Mr. Pallone, for his 5 minutes of questions.
Thank you, Madam Chair. And again, I don't want to pick on Mr. Guthrie, but I don't think he accurately portrayed what happened at the HR 3 hearing or what happened at the border. I mean, it's clear that President Trump's administration forcibly separated kids from their families at the border and caused terrible damage to the kids and to the ORR program. I don't want to debate that here, but I mean, to suggest otherwise, I just don't think is accurate. Also, the president said in his joint address that he wanted to have legislation passed this year to lower the price of prescription drugs by giving his administration the power to negotiate prices, and specifically said that that money should be a pay for healthcare programs. I mean, I don't think there's any question that that should be used for, things like ACA, Medicare, Medicaid. That's the president's position, and that's certainly my position. But I wanted to get into quickly, if I could, Mr. Secretary, ask about negotiated prices, about public health infrastructure, and then finally mention the provider relief fund. So let me quickly get into this. On the prescription drug issue in HR 3, I just want your opinion. The testimony at the hearing last week is that in order to effectively reduce prescription drug costs, we have to have a comprehensive solution like HR 3 that includes negotiated prices. And so from your perspective, is empowering the secretary to negotiate drug prices an essential tool to lowering drug prices?
Chairman, absolutely. I think the president's made that very clear, and I'll restate that. Absolutely. If we want to lower those drug prices, we have to have the ability to negotiate.
Well, thank you. Now, let me get to the second thing. In both the LIFT Act, which is our committee's infrastructure piece, and the Moving Forward Act, which passed in the House in the last session, we specifically included protecting and investing in the public health infrastructure. Now, I'm not asking you to specifically comment on that legislation, but I just wanted to know whether you would support investments for our public health infrastructure, for example, improving our public health labs infrastructure or modernizing our hospital infrastructure. We would like to have that as a component of any infrastructure package considered in Congress. And I know you said that you would support whatever we put forward, and that's fine. But I wanted you, if you would, to comment on the need to have a public health infrastructure component in this, if you would.
Well, Mr. Chairman, there is no doubt that the president and we at HHS have a wish list of what we would love to see you do, but we ultimately will work with whatever you are able to pass. But without a doubt, we must end the cycle of boom and bust funding for our public health infrastructure. We have to make the kinds of investments that we saw in the American Rescue Plan. That helps us secure long-term funding at the federal, state, and at the local level. And so for sure, we have to do this the right way that gives real certainty moving forward of how we're going to be able to expand healthcare and make it more affordable.
All right, and the last thing, I guess, is not really a question, Javier, but I did want to mention it. I wanted to mention that I'm very interested in how the department is distributing the critical funds provided by Congress over the last year through the Provider Relief Fund. I was constantly trying to push your predecessor to get this money out in an effective way during the COVID crisis. And I understand our staffs have been in touch to schedule a briefing on the funds that remain. And Yeah, I just wanted to urge the administration to permit providers who have received these critical funds to extend their availability through the end of 2021 as we continue to respond to COVID. You know, this provider relief fund ensures that frontline workers can keep their doors open during this time. And it's just imperative that the funds go to those who need it the most. Again, I'm not asking you a question, but you know, and everybody on this committee on both sides of the aisle knows that we were very concerned during the pandemic under the Trump administration with the various tranches that much of it was not using formulas that actually got it out to the areas that had the greatest need. And so I just want to express our concern. If you want to comment on it, you can. I'm not asking you a question, but if you want to comment on it, you certainly can.
Mr. Chairman, we hear you loud and clear. We couldn't agree more with what you've just said. And I will only add that for me, what will be important with regard to the Provider Relief Fund, having been at the state level at the time that it was first being implemented, we're going to demand accountability and transparency as we disperse the remaining 25 billion or so that was originally in the pot, and also the 8 billion or so that was made available for our rural communities.
Thank you so much. Thank you, Madam Chair.
The gentleman yields back. The chair now recognizes the ranking member of the full committee, Ms. McMorris Rogers, for your 5 minutes of questions.
Thank you, Madam Chair. I'm concerned because it sounds like the Democrats want to take the Medicare dollars and pay for ACA policy again. But, well, I'm going to move on. Mr. Secretary, I thank you for your commitment to price transparency. You recently responded to a letter, and I do hope that that's an area where we can work together to enforce the rule and continue to get that price transparency, which is so important to patients across the board. I have some questions here. Mr. Secretary, I know President Biden is noted for saying, quote, "Don't tell me what you value, show me your budget, and I'll tell you what you value." So one thing that I hope that we can all agree on is the dignity and the value of every life, including those Americans with disabilities and debilitating diseases. For years now, the National Council on Disability, an independent federal agency, has warned policymakers about relying on quality-adjusted life years. That's QALYs. So, Mr. Secretary, first, I wanted to ask, do you agree with the National Council on Disability and the Consortium of Citizens with Disabilities that relying on QALYs is an unacceptable and discriminatory policy?
Congresswoman, thank you for the question. And I couldn't agree more with you that we have not done enough to focus on issues of health for folks with the disability. More and more, we're beginning to realize that so many of our loved ones actually have a disability, whether physical or mental. And more, we're learning, unfortunately, to our detriment, that we haven't provided the same level of resources and commitment to tackle those types of conditions as we have for the more common types of physical ailments. And so I will tell you that I absolutely agree with the general concept that we have to do a better job of making sure we're targeting money and getting things done for our Americans with a disability. What I will tell you is that I'm sorry.
Okay.
Go ahead.
Well, I wanted to ask specifically regarding QALYs is this a policy of a quality-adjusted life year. And I wanted to ask if there would be any provisions in your budget that would give you as Secretary the authority to set prices based upon foreign drug prices that are established using quality-adjusted life years.
Congresswoman, let me say this. I know that the team at HHS can probably give you some particulars on this. I won't profess to be the expert, and so what I will do is this. I will take this matter back to the folks at HHS, and I look forward to being able to respond to you as quickly as possible. Again, if it involves drug prices, we're going to do something.
Okay, well, we all are committed to bringing down drug prices, prescription drug prices for patients. One of my biggest concerns with the proposal right now that is before this committee is that in an effort to bring down prescription drug prices, It includes a reliance on foreign drug prices developed using qualities. So foreign drug prices that measure quality adjusted life years. So they're determining the value of an individual, especially an individual with disabilities. And so that's one issue that we really need to address. I wanted to ask also about Medicare for All, because we continue to hear the drumbeat about Medicare for All. And we know that households with employer-sponsored health coverage would on average have more than $10,000 less in disposable income every year with this policy. Medicare for All or a single payer system would cost more than $32 trillion over 10 years, a doubling of our projected taxes over that period. And I just wanted to ask if you would commit in your budget to not include a Medicare for All proposal that would take away employer-sponsored health insurance from 180 million Americans.
Congressman, I can assure you that the president has spoken with a clarion voice on this issue. He campaigned on this, and everything he's done so far makes it very clear. We're going to work to make sure that we can expand the Affordable Care Act, make it better. And as a result of the American Rescue Plan, I think virtually every American can say it is actually much better. And certainly the million people who have in the last few weeks signed up to get a plan under the Affordable Care Act are showing full proof that the
Thank you. I have one more question. One more question. During your confirmation hearing, Senator Daines said, or you responded to Senator Daines and said, quote, "My job will be make sure that I'm following the law. The Hyde Amendment, which is current law, makes it illegal to use taxpayer dollars to fund elective abortions." Do you continue?
The gentlewoman's time has expired.
Okay. I'll ask that question in writing. Thank you, Madam Chair.
Thank you. Well, I think we're all going to be submitting questions in writing to the secretary. The chair is pleased to recognize the gentleman from North Carolina, Mr. Butterfield, for your 5 minutes of questions.
Thank you, Madam Chair, for convening today's hearing, and thank you for extending the courtesy to our good friend, Secretary Becerra, this morning. Good morning, Mr. Secretary. It's good to see you. I wish we had time to chat this morning, but I'm going to get right to it. I would like to focus just a few minutes of my time on the investments in biomedical research put forward in this proposal. For decades, publicly funded research has laid the foundation for the treatments and cures patients use today. NIH, which has long enjoyed bipartisan, bicameral support, is the largest public funder of biomedical research in the world. And the positive impact of this agency is clear. Heart disease and stroke and diabetes are less deadly. Cancer mortality rates are also overall on the decline. Americans are living longer, healthier, yet there's always more we can do to support the health of our constituents. And so I applaud the administration for investing more resources into biomedical research. And I'm really interested in learning more about the proposed Advanced Research Projects Agency. We call it ARPA. I'm interested in learning more about this. Mr. Secretary, the funding request put forward $6.5 billion for the creation of ARPA-H, which I understand is part of a larger $51 billion request for NIH. Can you talk with us about the responsibilities for this new agency?
Congressman, absolutely, and great to see you. We'll consider this a 5-minute chat. What I will tell you is that ARPA-H is meant to complement, not compete with NIH's basic research. And what we will do is hopefully be the springboard to take some of those budding ideas and actually start them off on a fast track. And we're going to partner far more with the private sector because we know that they're incubating some of these things as well. But if you don't have a dedicated source of funding for that, with an agency that has a proven track record, as you've said, of success, it's hard to get the private sector to believe that they should make the same investment to try to do this. COVID-19 is now being attacked by successful vaccines. Why? Because it was a partnership. And we did everything to accelerate those vaccines as much as we could while still maintaining safety. And so ARPA-H gives us a chance to say, on something in the future, we're going to do the same thing.
How do you envision the work of ARPA-H coinciding with other NIH institutes, such as the National Center for Advancing Translational Sciences or the work of NIH in general? How are we going to coordinate these efforts?
As I said, Congressman, they're going to complement each other because remember, NIH does the foundational research. Before you can ever run, you have to learn how to walk. And before you can walk, you have to learn how to crawl. NIH is the body that has shown us scientifically with facts how you learn how to crawl, walk, then run. What we're simply saying with ARPA-H is, look, this kid is learning how to walk a lot faster than we thought. Shouldn't we invest a little bit more money to find out why it is that that's the case? And it then complements the work that NIH has already done to let us launch on some of these innovations. Because I guarantee you, Congressman, if you or I had a loved one who was dying of Alzheimer's, we would want to know if there's some innovative, promising research out there that we could launch it faster.
I'm glad you mentioned Alzheimer's, Mr. Secretary. The request identifies a few specific diseases like Alzheimer's and cancer and diabetes. And although I think we can all agree that scientific progress in these areas would be welcome, how might this agency target other important areas like heart or respiratory diseases, which are also leading causes of death?
Congressman, that's the big question, right? And I will tell you the best response that I can give you is we will follow the science. We won't let politics drive us. It will be the science, because what we want is for Americans to have confidence that when we launch, it's because we're driven by the data and the science, not because we decided to drive it in the direction of one politician or the other. It's got to be science driven.
This is innovative and exciting. Thank you very much, Mr. Secretary. I yield back, Madam Chair.
The gentleman yields back. It's a pleasure to recognize the gentleman from Michigan, the former chairman of the full committee, highly valued member, Mr. Upton, for your 5 minutes of questions.
Well, thanks very much, Madam Chair and Mr. Secretary and friend. Welcome back before our committee. We got a couple questions. You know, as we know, the drug industry helped our country get into this very enviable spot, having access to life-saving vaccines for COVID-19, in large part because of what we were able to accomplish in this committee unanimously when we passed 21st Century Cures, which President Obama signed in December of 2016. And while certainly the industry deserves credit for the speed and efficacy of these medications, and we made sure that there were no safety standards that were removed, while I understand the desire to help other countries suffering from COVID, look what's happening in India for sure, I want to make sure that it's a responsible way for all parties, which is why a number of us are very concerned about the administration's recent support of the waiver to release and transfer the IP for the vaccine, which may have a real chilling effect on innovation in the future. So Dr. Gottlieb argued that a much more effective means of helping other countries would be to, in fact, ramp up production here in the US. And I'd like to ask, did the administration consider other options besides IP transfers, like what Dr. Gottlieb suggested? And if so, what were they and why were they rejected in favor of the IP transfer issue?
Congressman, first, great to see you again. Thank you for the question, critical question. I have to first say there's no country that has done more to help the world when it comes to tackling COVID than the United States of America. And that's because of the generosity of Congress, our federal government, but most importantly, the American people. And what we're going to continue to do is help, as we are in India, for example, with the pipeline of PPE. We are doing everything we can to help them accelerate the production of more vaccine. We're going to do our part as a global citizen and as the most important country and powerful country in the world. What I will tell you is that when you have extraordinary circumstances, as we have with this pandemic, you have to apply extraordinary measures. And so we're going to do everything under the sun, all of the above list, to try to see what we can do to try to help the global community recover. And what we are doing is exactly that. We're going to do it at the same time. We want to respect those that make those innovations possible. And so we're going to try to promote the access to vaccines and promote access to the materials, the PPE and so forth that the world needs, but do it the right way, because we understand that this is a partnership, not just among countries, but with the private sector as well.
But did you actually look at going back to the industries, the Pfizer, which happens to be in my district, go back to those and ask if they could further ramp up their production, that in fact we might be able to send those doses rather than share that IP technology?
Absolutely. The Biden administration has been having conversations with the industry from the very beginning, and it continues to this day. No action has been taken without having consultation with all those who are stakeholders, and certainly the industry that has helped create these vaccines is part of the stakeholder group.
Well, I know we've talked a little bit about ARPA-H in this hearing, and Chair Eshu and others were involved in a meeting with the president in the Oval Office back in March. We're all very excited about ARPA-H, and obviously we want to make sure that it doesn't interfere with the other functions that the NIH and others have. We have made the pledge as we look to the future, as we look for an update on 21st Century Cures, to in fact include ARPA-H as part of that to help us get that legislation through. Really appreciate your input to try and make sure that everybody is on the same page. So we look forward to working on that. We're very pleased to see that in the president's budget. It was released early on, shortly after, in fact, the meeting that we had in the Oval Office. We're looking forward to get that done. I might just compliment Janet Woodcock, the acting director of the FDA. She was a mighty big player as we worked to listen to all the different parties, asking what we could do to expedite the approval of drugs and devices in 21st Century Cures. I know you know her well, but I just, we appreciate her mastery, continuing to work with us, and look forward to that relationship, particularly as we look to do an update 2.0 on cures. And with that, Madam Chair, I yield back.
The gentleman yields back. I join him in his well-earned praise of Dr. Woodcock. She should be the next permanent commissioner, I think, of the FDA. The chair now recognizes Dr. Burgess of Texas for his 5 minutes of questions. Oh, I'm sorry. Mea culpa. The chair now recognizes the gentlewoman from California, Ms. Matsui, for her 5 minutes of questions, followed by Dr. Burgess.
Thank you very much, Madam Chair, for having this hearing. And Mr. Secretary, it's really wonderful to see you in this new role, and I look forward to many other conversations as we move forward. Over the past year, our nation has simultaneously confronted the COVID-19 crisis, multiple incidents of systemic racism, and an economic recession. Understandably, these crises have impacted the mental health and well-being of millions of people. In response, the Biden-Harris administration stepped in and requested $4 billion of emergency support through the American Rescue Plan for mental and behavioral health services, including certified community behavioral health centers. While these actions are important, we must continue to look ahead. This HHS funding request proposes $1.6 billion for the Community Mental Health Services Block Grant at SAMHSA. I do applaud the administration for this historic investment, as we know this block grant acts as an important safety net for some of our nation's most vulnerable. Mr. Secretary, the pandemic has been especially disruptive for America's children. How will your department prioritize the mental and behavioral health needs of children and young people?
Congresswoman Matsui, I feel like I'm at a family reunion, and so forgive me for saying that, but it's so nice to see so many. By the way, there's a lot of disagreements even among families when they get into these reunions, so I understand that. But at the end of the day, we're still a family. Children, you've hit it on the mark. I think we want to make sure we do everything we can to address the stresses that our kids have been facing. Sometimes they don't have the same markers and they don't express it the same way, but we know it's there. And so we've made an historic investment in behavioral health and mental health services. SAMHSA will have an increased budget. We're going to do everything we can to deal with the trauma and the stress that kids are facing. And we look forward to working with you to make sure we do it right.
Well, thank you very much for that, Mr. Secretary. And also, I want to just take a minute to raise an issue that I know you are familiar with, the ongoing actions of drug companies who have chosen to rewrite the 340B program to deny discounts on drugs dispensed through covered entities contract pharmacy. As you know, HHS has issued an advisory opinion concluding that these actions are illegal, yet drug companies have made it clear they do not intend to comply with the law. I, along with over 220 of my house colleagues, wrote a letter to you earlier this year outlining a strong opposition to these actions. The 340B is essential to providing access to care to low-income and rural patients. I encourage you to take swift enforcement action to put a stop to these efforts to undermine the program. That's my comment to you. Okay, I'm on to telehealth now. In the past year, telehealth has truly taken root, and we've seen exponential growth in the adoption of virtual care across Americans of all ages, locations, and conditions. As Congress considers permanent telehealth reform, we'll need the support of HHS in sharing evidence to assess how telehealth flexibilities extended in response to the pandemic impacted both the Medicare program and beneficiaries. With that said, Mr. Secretary, do you believe that there are some telehealth regulatory restrictions that Congress and HHS can work together to address in the near term that do not require additional data? For example, the statutory limitations on using telehealth in certain zip codes or requiring beneficiaries travel to a clinical setting to receive virtual care.
Congresswoman, we learned a lot through COVID about telehealth, and there's some things that we can do without Congress having to pass a law to make telehealth work better. We have some flexibility, and we're going to do everything we can based on what we learned, the facts and the evidence that we learned from COVID. What I will tell you, though, is that we're going to still have to climb that mountain when it comes to broadband access around the country. We have to make sure that we deal with the transportation issues that sometimes make it, even with telehealth, difficult for families. And we have to have the flexibility to put the money where it should go. And so we'll work with you, because I think we've all now learned that telehealth can be a godsend for those who don't have easy access to healthcare.
Right, absolutely. We found that out during this crisis, and certainly as far as broadband access, that's also the purview of this committee too, so we'll be working with you. Thank you very much. It's great to see you, and I don't know whether you're my constituent, yes, but it's great to have California in there. Thank you, and I yield back.
The gentlewoman yields back, and the chair now recognizes Dr. Burgess for your 5 minutes of questions.
I thank the chair, and Mr. Secretary, welcome to our humble subcommittee. Mr. Secretary, I've got a couple of questions on the Texas Medicaid 1115 waiver. So, you know, that was originally issued back in 2011, extended in 2017, and then Texas had received in early January a 10-year extension on the 1115 waiver. It wasn't a new program, it was an extension on an existing waiver. Since then, about 3 months later, the 1115 waiver extension was totally rescinded. And this has created a great deal of uncertainty for the state of Texas, certainly for doctors, certainly for patients, certainly for hospitals. Very difficult for hospitals who are having to plan ahead for their fiscal year and plan for their financial stability and dealing with the financial hardships from the pandemic. So could you tell the committee a little bit about the process involved in rescinding this waiver 4 months after its approval?
Congressman, first, great to see you, and thank you for the question. Important one, because it's not just Texas. There are a number of states who have requests for waivers. First, it's important to make it clear that Texas continues with its existing waiver, which still has close to 2 years to run. What we have been discussing with Texas is the extension, which was an extraordinarily long extension of 10 years. Typically, they'd run about 5 years, and it dealt with a lot of money. And so what we wanted to make sure is that if there's going to be an extension of an existing waiver, that it complies with all aspects of the law. And where we found it deficient was in the public comment, that the notice and public comment that was not provided for something that was so big in terms of money and for such a long time. And so we are working with Texas to make sure we address their interests and try to make sure that we can move forward with something to extend their waiver.
Yeah, you know, my discussions with former CMS Administrator Seema Verma, you're in the middle of a pandemic, it was an existing program. And so it was not, in her opinion, it was not unusual to condense the comment period and allow for the extension. But can you just tell me at what point you became involved in the decision to rescind the waiver?
Well, Congress, remember, we didn't. The previous administration didn't condense the notice and comment. they didn't hold any notice and comment. There was no opportunity at the federal level for anyone to comment on this.
Okay,
waiver.
so when did you become involved in the decision to rescind the waiver?
Well, HHS has been working on this. CMS has been working on this since before I was confirmed, and we are working on it simply because it did raise a number of serious concerns about how it was administered and promulgated.
Okay, so here's the problem that I have, Mr. Secretary. There was an acting administrator prior to you, Acting Administrator Fletcher, but it seems unlikely that this decision she would have made that decision on your own. Wouldn't that be unusual for an acting administrator to make a decision of that significance just on their own?
Congressman, I can't tell you how other administrations have worked and how administrators at CMS have worked with the secretary. I am very involved. I try to be very involved with all the different shops within HHS, but I can tell you that in this particular case, before I was confirmed and had a chance to sit in this seat, work was already being done on these particular types of waivers. So we continue to work with Texas. We've never not worked with Texas and your delegation, and we will continue to do so. At the end of the day, this is about making sure Texans and all Americans have good healthcare the right way, and we all comply with the law. So I think that so long as we all can feel like there's public notice and comment provided, that we are providing the right resources to do the job for Americans, we will see an extension. But remember, this is an extension that would not take place until what, 2023 or beyond.
Let me just go back to the question, though. Has an acting administrator ever rescinded a state flexibility waiver before?
I can't answer that because I don't know what previous administrators have done.
And that would be the other part of the question. If an acting administrator has ever rescinded a state flexibility waiver previously, what about a state flexibility waiver granted by a previous administration? That is a new administration coming in and going back and saying, no, you don't have that flexibility waiver after all. It does strike me as an unusual and politically motivated decision. And I do have a number of things, Madam Chair, that I've submitted for the record, and I'd ask those to be made in order at the appropriate time at the end of the hearing. I recognize the constraints of time, Mr. Secretary. I will follow up with you about this. I appreciate your answers. And I'll yield back.
Yeah, I asked at the beginning of the hearing that everyone stick with their 5 minutes. The gentleman's time has expired. The chair now recognizes the gentlewoman from Florida, Ms. Castor, for her 5 minutes of questions.
Well, thank you, Chairwoman Eshoo, for calling
you
this
not
very
unmute
important
me?
hearing. And thank you, Secretary Becerra, for joining us today. It is great to see you. It's also heartening to see President Biden's budget prioritize affordable health care for American families. It is clear that your aim is to help our communities back home build back better and healthier. And I wanted to share with you what I'm hearing from Florida families. First, they are grateful for everything that is being done to crush COVID-19. It is remarkable that we've now reached the milestone, thanks to the American Rescue Plan and all the hard work of everyone, that we have 150 million Americans with their vaccination already. I know we have a ways to go, but kudos to you and everyone at NIH, FDA, CDC, all across the enterprise. I'm also hearing how grateful they are for the Affordable Care Act. You know, ever since it came into law, Florida has led in the number of signups in the healthcare.gov marketplace. But due to the American Rescue Plan now, we've been able to lower premiums and lower co-pays. And it was great to see. It is such a lifeline for families. And Florida had 1/3 of that million person sign up under the special enrollment period. It was there when people lost their jobs during COVID. It's been there for them. And I also want to give credit to our navigators back home. They're the ones that are sitting with families, working through all of their options to choose the plan that is best for them. So thanks to HHS for making $80 million available for grants to our navigators, they are very excited about those additional resources, and you can see what it has meant for enrollment. But COVID-19 has also laid bare a lot of weaknesses. One of them was in data. It was a struggle, especially early on, to understand infection rates, testing. We had governors like mine that actually tried to hide some of the data. They weren't being transparent. And I really appreciate you all and CDC saying that you're going to use the resources we've provided to update the public health data systems. And I want to work with you on that going forward. And then one other thing before I get to my question, thank you and President Biden for your leadership on addressing the climate crisis. Hotter temperatures and dirtier air and water are impacting the health of everyone, but especially folks on the front lines. And in this budget request, you are proposing a new Office of Climate Change and Health Equity to help address the harmful impacts of the climate crisis, especially on communities of color and communities on the front line. So here's my question. It has to do with junk plans. The Trump administration finalized a rule to expand short-term limited duration plans. Of course, you know, these junk plans are not required to comply with the consumer protections in the Affordable Care Act. Oftentimes they discriminate against people with pre-existing conditions. They limit benefits and they leave our neighbors back home often with these huge surprise bills. Even former Secretary Azar agreed when I asked him if these plans discriminate against folks with pre-existing conditions, he agreed. So you're aware of how these junk plans operate, Mr. Secretary, aren't you?
Sorry. Yes, I am, Congresswoman, and you're absolutely correct.
So on January 28th, President Biden signed an executive order directing your department to review all existing regulations, guidance documents, or policies that undermine the Affordable Care Act and raise costs on families and undermine protections for pre-existing conditions. Has your department undertaken a review of this junk plan final rule to ensure that it's consistent with the policies set forth in the President's executive order?
We are undertaking that review as we speak.
Terrific. Well, we'll be very interested in that. And also the American Families Plan, if there's something that we need to do to make sure that healthcare is affordable for families, maybe continuing the policies we enacted in the American Rescue Plan to make sure the premiums and co-pays are affordable for families. And there's something we need to do to address junk plans and a lot of these fly-by-night operations that take advantage of our neighbors.
Gentlewoman's time has expired.
Thank you, Madam Chair. I yield back.
The gentlewoman yields back. Pleasure to recognize the gentleman from Virginia, Mr. Griffith, for your 5 minutes of questions.
Thank you very much, Madam Chair. I appreciate it. And Mr. Secretary, I appreciate you saying earlier that you were willing to work with all of us, and I do greatly appreciate that. On May 14th of 2020, almost a year ago, we had a hearing in our committee, and a Michael Bowen of Prestige Ameritech told his story about how he invested in machinery to make masks, et cetera. At that time, our country was struggling to find the PPE necessary just for our hospitals.
Would the gentleman suspend for a moment because the clock is not correct? Whomever's in charge of it, please reset the clock so that the gentleman's 5 minutes are, that he has the 5 minutes. No, please reset the clock, whomever's in charge. Well, why doesn't the gentleman continue? I'm sorry. Right, so I'll try and time you on my watch. How's that?
Yes, ma'am, I appreciate it. Thank you very much.
Thank you for talking about Mr. Bowen.
Yeah, so Mr. Secretary, Mr. Bowen was very concerned, and he wanted us to guarantee him contracts with the federal government because the last time he had done this, geared up and started making more masks, as soon as our crisis was over or as soon as there was a supply from foreign suppliers, all of a sudden he had no business. The Asian markets shut him out. They put a lot of products onto the market at low prices, and he was not able to compete effectively, and had to shut down a lot of his equipment, had it put in mothballs, et cetera. And before he geared it back up, he wanted to know, are we going to be buying American? Likewise, since that time, a number of companies, as a result of the need in this country, a number of companies in my district and across Virginia started making PPE. There's a company that I've been talking with out of Elaine Lauria's district. There's a company in my district. I know there's at least 3 or 4 in my district that have started, and they're all saying the same thing. Now that the Asians have gotten a hold of the situation, they are once again dominating the market. And in fact, one of my sources tells me that a recent contract was let where they could have competed just fine, but they weren't even aware of it. And a lot of folks who are supplying the federal government and other governments are, in fact, using these sources that are, all approved, et cetera, and then they outsource it to China and other countries. So what are we going to do? Do we need, and I would submit that we do, but I want your opinion, do we need a Berry-style amendment to say that the federal government's going to buy its PPE from American manufacturers? Because if not, every time we have a crisis, we're going to have another boom and bust. You said earlier you didn't like boom and bust funding. That's what these small businesses in the United States are now facing, who were willing to make the PPE, make it at a reasonable cost, and sell it to whomever. But if they're just going to get shut down every time by markets overseas, it doesn't make sense. And it doesn't make sense for long-term policy in the United States. What say you, Mr. Secretary?
Congressman, what I say is I am with you in everything you just said. If we didn't learn a lesson from COVID, that too much of our supply was not at our disposal. And by the way, that is a risk for the life and health of our people. If we have to depend on others, then we're in trouble. Not only that, why is it that we can't have Americans producing what Americans need? And President Biden is on top of this. And we have a $10 billion fund that you all made possible through the American Rescue Plan and other initiatives to try to make sure we boost domestic manufacturing. And we're going to be on that one. And I hope you all will work closely with us, because we want to prove to Americans that if they're willing to make an investment and produce here, we want to support them, because there is no excuse for us to have to go somewhere abroad to get masks when we got Americans willing to produce them here. And by God, I think this is one that we could take on a bipartisan basis.
Well, I would agree. It can be bipartisan. It's masks, it's gowns, it's gloves, it's everything. And on January 25th of this year, the president signed an executive order ensuring the future is made in all of America by all of America's workers, and asked each of the agencies to look into that. Do you know what your agency has found out so far, or what we can do even before we can maybe get a bill passed?
We're going to continue to do the work on that. We can report to you back. I look forward to talking to you on that. But what I can tell you is this, that we're going to make sure that the $10 billion that have been made available for the Defense Production Act are accountable dollars, and that Americans take a look at where it went. And so we have to be transparent in the use of that money. And I hope you all will work with us to make sure that we bird dog that one.
Well, I heard from the chair of the full committee that we're going to be doing an OOR. Is my time up, Madam Chair?
Just about. I think you have 5 seconds left.
All right. I'm just going to say we're going to have to talk some more about OOR, but I would like to see us buying all the PPE for those facilities from American sources. Thank you. I yield back, Madam Chair.
Amen to the gentleman. The chair now recognizes the gentleman from Maryland, Mr. Sarbanes, for his 5 minutes. And just hold for a second. Whomever is controlling the clock, excuse me for putting it this way, you're doing a lousy job, because it's really messed up. And we need every second, members need every second they can get to question the secretary. So would you please reset the clock?
It's a technical problem.
It's a technical problem. Well, you know what? We'll keep track on our iPhones here, Mr. Sarbanes. So you're recognized for your 5 minutes. I'm sorry.
Thank you, Madam Chair. Secretary Becerra, welcome to the committee. It's great to see you And thank you for coming to discuss the 2022 budget. Over the past year, obviously, we've made incredible investments in our healthcare system through bills such as the CARES Act, the American Rescue Plan. We have to continue to ensure there's robust funding for programs that will help us recover from the coronavirus pandemic and ensure the long-term viability and stability of our healthcare system. You're obviously in a very, very critical position to help facilitate that. In your testimony, you wrote, "Our experiences as children shape the adults we become, and support in childhood can mean success in the future." And I couldn't agree more with that. I know we share a commitment to ensuring that our young people have what they need to succeed. One important program for our youth are our school-based health centers. And I was proud to have my bill, the School-Based Health Centers Reauthorization Act, passed last December. My pride of ownership in that is really just derivative of an extension of Lois Capps' investment in that issue for many, many years, as you know, being a colleague and obviously a fellow Californian. School-based health centers provide high-quality, comprehensive primary health care, mental health services, preventive care, social services, and youth development to primarily low-income children and adolescents across the nation, play a critical role in helping to reach underserved populations and achieve health equity. During this pandemic, many school-based health centers have been using telehealth to reach students and provide the healthcare services they need. However, it's incredibly important that SBHCs are able to stay open, especially as children come back to school and may require a variety of oral, social, medical, mental health services. Can you speak to the investments that will be made in school-based health centers or similar programs for our youth in the 2022 HHS budget? And what additional investments would you recommend to ensure that children receive the health and mental health services they need following the coronavirus pandemic? Let me just say, I look forward to working with you to expand the impact of school-based health centers and be as creative and innovative there as we can possibly be. Thank you.
Congressman, as usual, we're on the same page on this subject, and I will tell you that HHS will do everything it can to make these school-based health centers successful. As you know, we don't dictate to the locals how they do things, but we do help them. We assist with resources, we provide guidance, and I will tell you that if we're smart, we'll be able to use some of the investments that are in the president's budget to help with our children, whether it's children who are in need of special care, or whether it's those with a particular disability, or whether it's just making sure we get these kids back on track when they get back to school. We want to make sure that they're supportive. And fortunately, with the help of Congress, with your work and others, in the American Rescue Plan, and if we get the American Family Plan through, I can guarantee you that HHS will be very busy working with our school-based healthcare centers to make sure that kids have what they need to succeed in life.
Thanks very much. I look forward to that collaboration. I yield back, Madam Chair.
The gentleman yields back. The chair now recognizes the gentleman from Florida, Mr. Bilirakis, for your 5 minutes of questions.
Thank you. Thank you very much, Madam Chair. I can't get this to work here.
You sound fine. Sounds like it's working.
Yeah. I can't read that. Okay, got it. All right, Secretary Becerra, thank you, Madam Chair. I appreciate it. During your confirmation hearing, you told Senator Daines that when it comes to laws related to abortion, and I'm quoting, "My job will be to make sure that I'm following the law." And the question is, do you agree that partial birth abortion is illegal, sir?
Congressman, thank you for the question. And here, as I said in response to some of those questions during my confirmation hearing, we will continue to make sure we follow the law. Again, with due respect, there is no medical term like partial birth abortion. And so I would probably have to ask you what you mean by that to describe what is allowed by the law. But the Roe v. Wade is very clear, settled precedent, and a woman has a right to make decisions about her reproductive health. And we will make sure that we enforce the law and protect those rights.
Okay, and you agree with this particular law?
Which law are we talking about, sir?
Law concerning partial birth abortion.
Well, again, as I said, there is no law that deals specifically with the term partial birth abortion. We have clear precedent in the law on the rights that women have to reproductive health care. And we, as I said in that confirmation hearing, we will follow the law and protect the rights of all Americans to their health care.
Thank you. And so you will follow the law, you will enforce the current law. Thank you very much. I want to get on to the next question. Mr. Secretary, 93 to 95% of the 7,000 known rare diseases have no FDA approval therapy. I think you know this. For those who do have a therapy available, the development process takes an average of 15 years. As the co-chair of the Bipartisan Rare Disease Caucus, I believe we can do better in the United States. And FDA, we know this. Okay, do you agree that we can do better? And that one way to do this would be to ensure coordinated, dedicated efforts at the FDA to make sure they're aligned to address the unique challenges rare diseases patients face. So that's my question, sir.
Congressman, we should always strive to do better. That's what we will do here at HHS. And I hope you are supportive of our efforts with ARPA-H because that will allow us to do better.
Okay, and I believe coordination, of course, is the key. I introduced HR 1730, the Speeding Therapy Access Today, or the STAT Act, with my Rare Disease Caucus co-chair and good friend G.K. Butterfield. This bipartisan legislation at its core would create a center of excellence for rare diseases at the FDA. The Center of Excellence model has been embraced by the FDA in recent years and was originally authorized by the very popular bipartisan 21st Century Cures Act of 2016. As we've been seeing with the oncology COE, FDA, we know this model can help advance therapies and regulatory science. So the next question is, and I'm not sure how much time I have left, but the next question, yeah, would you like to address that, sir, in any way?
Congressman, why don't you pose the question so I know what you'd like me to address?
Okay, well, do you agree with the Center of Excellence with regard to the rare diseases? Do you agree we can do better? That one way to do this would be to ensure coordinated, dedicated efforts at the FDA, make sure they're aligned to address the unique challenges rare disease patients face.
Congressman, I think that is being done, and certainly we can always try to do it better. But I think at FDA, I think you can say that we have the strongest agency around in the world to try to deal with these innovations and these therapies and treatments that we need for these rare diseases. But we can always do better, no doubt.
I think this bill will really speed up the process. So I look forward to possibly discussing this with you along with my co-chair colleague. Mr. Secretary, the next
the gentleman's time has expired.
Oh,
and again, we apologize to members for the mess up with the clock that you see on your screens, but we're keeping track by iPhone right to the second. So I think the gentleman yields back. We thank him, and the chair is pleased to recognize the gentleman from Vermont, Mr. Welch, for his 5 minutes of questions.
Thank you very much. Welcome and congratulations. Mr. Secretary, I have questions in 3 areas. One is the 340B program, 2 is the new ARPA-H program, and 3 is prescription drug price negotiation. I know you're concerned about access to healthcare in community health centers and community hospitals, and I've been alarmed, as my local hospitals and community health centers have been, that 6 pharma companies, I believe illegally, are not passing on the discounts required under the 340B program. Is it your intention to enforce continued access to the discounts for our community hospitals and community health centers?
Congressman, first, great to see you. Secondly, we are on this one because we know that vulnerable populations are at risk. And so everyone, I've been saying all along, we have to follow the law. Everyone has to follow the law.
Okay, thank you. Second, we're all excited about President Biden's $50 billion program, ARPA-H. And of course, that is going to focus on cures for Alzheimer's, diabetes, and cancer. Is there any consideration to including Lou Gehrig's disease, ALS, in research that would be benefited by that fund?
Carson, that is where we're going to be working with you and the White House to make sure we know how to focus the money. We certainly could use more than $6 billion to address all these deadly diseases, but we're going to try to let the science drive us there because that's the best way to ensure that we'll have not just a good result, but one that people will trust.
Thank you. Finally, on prescription drug pricing, there is a dispute here. Pharma companies do not want the U.S. to be involved in price negotiation. Yet we've just had a recent example where negotiation was very successful. Government worked in partnership with pharma. We got the vaccine. There was a agreed upon price, $19.50 per dose. The Pfizer executives now saying after the pandemic, they may go up to $175 per dose. My concern about healthcare in general is that the cost is too high and not sustainable. It hurts taxpayers, hurts private employers trying to provide access. Pharma concern about price negotiation is that the government won't be fair. Now, pharma is happy with government providing patent protection, providing a market through the Part D program, providing taxpayer funding through Medicare and Medicaid. You would play a major role in any kind of price negotiation plan that occurred. How would you address the purported concern that if the government negotiated so that we did not continue to pay 3 times, 4 times what other countries pay, we would still be the leader on innovation?
Great question, Congressman. What I will tell you is first and foremost, failure is not an option here in dropping drug prices. We have to do better, especially when we see the rest of the world paying less than we do for some of these same drugs. So President Biden's made it very clear. He wants to see negotiation of these prices. We can make this a win-win for everyone, including the pharmaceutical industry. We have to make sure that we're partnering with them. We have to have them sitting at the table, but we have to make sure we're moving. There's no reason why America should be paying this much for their prescription medication. And so whether it's tough love or sitting down and collaborating, one way or the other, we're going to have to drop the prices of drugs. And we want to have everyone who's a stakeholder be at the table when we do it.
Thank you very much, Mr. Secretary. Madam Chair, I yield back.
The gentleman yields back. Chair is pleased to recognize the gentleman from Missouri, Mr. Long, for your 5 minutes of questions.
Thank you, Madam Chair, and thank you, Secretary Becerra, for being here today. Good to see you again. And the President tasked HHS with a supply chain review of pharmaceuticals and API, among other sectors. At the time, he suggested that these sectors were so critical to the national security of the United States that their supply chains merited additional scrutiny. Last week, however, the White House announced that it was back in negotiations to eliminate international IP protections for these same products. Can you share the status of the supply chain review and your views on the importance of ensuring the United States has a strong and innovative domestic biopharmaceutical industry, including our future pandemic response?
Congressman, first, great to see you again, and thank you for the question. And actually, this is one where I hope you all will be very interested in working with us on this, because we want to work hard on this one. We want to pounce on this. President Biden has made it very clear. He made sure in the American Rescue Plan we had $10 billion so we could make sure we improve on domestic manufacturing and production. And we have to make sure that that supply chain is working. And so we hope we're able to work with you, because we know there are a lot of small businesses, innovators out there who want to be able to compete, and they think they got a good product. And so if we're working with you, we'll spot them and we'll let them know that we want them in the game. And so I don't know how better to say it than to say that on this one, there is no separation, I think, between you and me when it comes to making sure that American manufacturers, American small businesses have a chance to compete, to provide Americans what they need to keep themselves healthy.
Well, it seemed like a complete reversal, though, from the administration policy, and that's what I'm trying to get to the bottom of here. when last week, like I said, they announced that they're backing negotiations to eliminate what they said was very critical international IP protections for these products. So how do you weigh that out?
So remember, Congressman, that what the president announced is a way to get a global response to this pandemic. And we are willing to sit down and negotiate to see if there's a way to deal with this. But everything is still the same until we've negotiated. And once again, the stakeholders, in this case, the pharmaceutical industry, which has intellectual property protections, gets to sit at the table as we figure out how we get vaccines and other COVID responses out as quickly as possible to places like India. But right now, when we're talking about domestic supply chains, domestic manufacturing, I don't think there's any separation between what you've said and what the president said in making sure we are targeting American business for a lot of this resource that we're going to put out there to increase the domestic supply and keep that supply chain going with American manufacturers.
Okay, I'll have my staff follow up with you because I don't think that I'm communicating well this morning. I don't think I'm getting my question out to you in the proper form, apparently. But currently, all of the provider relief funds have been expended by June 3rd, or will be expended by June 30th, 2021. I've heard from several hospitals about the uncertainty surrounding this deadline, given the changes in the reporting guidelines. I know the Department of Treasury has issued guidance extending the timeline to the end of 2021 for state and local government funding expended under the CARES Act. Will HHS be issuing an extension to the healthcare providers regarding the use of provider relief funding?
Congressman, we're going to be working hard to make sure that we provide those healthcare providers who work very hard with the resources they need. Some of those folks have asked for an extension. We're looking at all that very, very closely. What I will tell you is that we're going to, again, be driven by the facts in this case to make sure those providers who have a need get those needs addressed. That's why you all pass the money, and that's why we're going to make sure that we can dispense it in a way that's not only accountable, but it really does go to those who need it most.
Okay, thank you. And President Biden's administration announced a $6 billion investment in community health centers to expand access to vaccines in underserved communities. However, the current Medicare FQHC reimbursement system may create a barrier to access of COVID-19 vaccines. FQHCs are not paid separately for vaccines, but are reimbursed by CMS 12 to 18 months after the fact. This has been an ongoing problem for flu and pneumococcal vaccines that have now reached critical levels of the administration of COVID vaccines to Medicare patients. Are you or will you commit to working with our health centers to address this issue so that they have the tools, resources that they need to provide expanded access to these vaccines?
Always had a good relationship with the community health centers and intend to have that as well. So we will work closely with them. Yes, sir.
Okay, thank you. Good to see you, and I yield back.
The gentleman's time has expired. He yields back. Pleasure to recognize two doctors coming up from our committee. The first, Dr. Ruiz of California, followed by Dr. Bouchon of Indiana. So you have 5 minutes, Dr. Ruiz, for your questions.
Thank you very much. Secretary Becerra, thank you for being here. I want to touch on a few different topics today. First, I would like to commend the administration for prioritizing vaccine equity and the distribution of vaccines into our underserved communities. As a doctor and public health expert vaccinating my constituents in underserved communities, I can say firsthand that President Biden's federal retail pharmacy program, mobile clinics, and direct vaccine allocation to FQHCs are effective. However, we still have a ways to go in reaching a national herd immunity. And I'm concerned by reports that vaccine rates are plateauing, while around 50% of Americans still need to be vaccinated, and with underserved communities still having low vaccination rates. In fact, the Desert Sun newspaper reported this week, after analyzing California HHS and Census Bureau data, that vaccine rates are still significantly higher in the white, older, wealthier zip codes in my district by up to 30% compared to poorer, younger minority communities. While some of that could be because older people were first to get the vaccine, older individuals in underserved communities still lagged behind. and all ages have been eligible since mid-April. Secretary Becerra, since we have reached a plateau in vaccination rates, has there been a shift in the administration efforts and methods around reaching the individuals that have not yet been vaccinated to address barriers like time, language, and transportation restraints?
Congressman Reese, great to see you. And the answer is absolutely yes. There have been changes made. In fact, later this week, I will be going to a rural community in California where there will be a small vaccination clinic targeting folks who are the most underserved and the most difficult to reach in some of our rural areas.
Thank you. I think that's very, very critical to partner with local communities and taking the vaccines to the people, and I applaud your efforts in doing that. So now pivoting to an issue that this committee worked on prior to the pandemic, which is surprise billing. My Republican colleague, Dr. Bouchon, and I worked with several of our colleagues in a bipartisan manner to craft a solution that would first and foremost protect the patient from surprise medical bills and to create a solution that is fair to both providers and insurers, which included a baseball-style arbitrator independent dispute resolution process that this committee and Congress adopted. And so I would like to ask you some questions regarding the implementation of the law. So first, regarding the IDR process, I urge the administration not to weigh any one factor to be considered by the arbitrator more heavily than the others. The legislation signed into law represents a balanced approach that treats providers and insurers equally and does not favor one party over another. I'm concerned that if any of the factors are weighed more heavily than the others, it will tilt the balance, resulting in an unfair system that will unintentionally lead to a benchmark rate which runs counter to congressional intent. Second, it is my understanding that HHS is meeting with stakeholders and requesting their input. I appreciate the administration soliciting feedback. I strongly urge you to move forward with a proposed rule that includes a full public comment period so that the process is transparent and all stakeholders have an opportunity to comment or provide feedback. Mr. Secretary, have you made a decision on the rulemaking process and whether it will include public comment?
Congressman, thanks for all the questions. We're going to make sure that people have an opportunity to know what's going on with these rules. We're going to try to move them as quickly as we reasonably can. What I will tell you is this, Paramount will be making sure that the patient doesn't get in the mix of any fight that may exist. We're not going to weigh any side more than another, and we're going to make sure that we launch these committees as quickly as possible. That'll help us make these decisions because everything you said is accurate.
Thank you very much. And for my final question, I'd like to ask about an issue near and dear to me, advance appropriations for the Indian Health Service. As you know, IHS is severely underfunded and continuously struggles financially, which hurts patients' access and care. So, Mr. Secretary, can you talk about the benefits of advance appropriations and how it will help the IHS better serve our tribal communities?
Our tribal communities, as you know, Congressman, have been underfunded, severely underfunded for too many years. President Biden has now made a major commitment to restore some of that funding, but he's also made the commitment that Indian country has been asking for a long time, and that is that they be treated when it comes to health the way we treat every other aspect of healthcare for all other communities, and that is that they have predictability in their funding moving forward. And that's why the advance appropriation is so critical, and that's why with your help, we'll get that done.
Thank you very much, Mr. Secretary. I yield back my time.
The gentleman yields back. The chair is pleased to recognize the gentleman from Indiana, Dr. Bouchon, for your 5 minutes of questions.
Thank you, Madam Chairwoman. I appreciate that. Secretary Becerra, thank you very much for appearing before the committee today. To show pretty significant bipartisanship, I'm going to focus on surprise medical billing, as my colleague, Dr. Ruiz, has just mentioned, in particular the agency's implementation of the No Surprises Act. As you probably know, Dr. Ruiz and I, as he mentioned, worked to advance legislation into law that's both fair and balanced. And most importantly, as you mentioned, take the patient out of the middle of all of this. That's the key. The No Surprises Act establishes an independent dispute resolution process that allows both sides the opportunity to present a list of criteria to an arbiter to make their case. The list includes, among other factors, the median in-network rate, market share, good faith, bad faith, efforts, and prior contracted rates. Some, in my opinion, biased economists have suggested subverting the intent of Congress by suggesting HHS should implement the law in a way that overemphasizes a low benchmark or qualified payment amount in the IDR process. Congress agreed to a deal that carefully balances a host of important arbitration criteria to make sure that no side has an unfair advantage. I want to echo my colleague Dr. Ruiz's concern in a letter that was sent asking for any rule promulgated by HHS to follow congressional intent in which the factors specified in the law must be weighted equally to ensure that patients have access to affordable and quality care. So my first question is, generally speaking, how do you intend to make sure the process is fair and balanced and doesn't just reverting to a benchmark in practice? We don't want that to happen, which this compromise framework in the No Surprises Act was intended to avoid.
Congressman, thank you for the question. And first, I have to just say thank you for the work that you all did to get this done. And now it is our job, as you said, to follow the intent of Congress on this. And so the most important thing we can say is what you said. We got to take the patient out from underneath the weight of these disagreements. And we make sure that that will be the case when we move forward with the committees that will explore these things. We're going to make sure that we've taken patients into account. But to your point, we're not interested in favoring one side over the other in the dispute. What we do want to make sure is we take the patient out of the dispute altogether, but then we're going to be even-handed when it comes to the dispute itself. And so the factors that will go into that, we're going to hear from everyone to figure out how we can have a balanced approach. And that's where your input will be important, because you all were the minds behind this, and we hope you'll provide us with a good input as we move forward to get this up and going. I appreciate that, because we do feel like congressional intent is to all the factors be weighed equally. And the law states that you as secretary, along with consultation from Treasury and Department of Labor, define what the median network in-network rate is. Can you guarantee that the data to calculate the median in-network rate is independent, valid, and transparent? That's our goal, Congressman, and you'll get to see the work that we do to make sure that's the case and hold us accountable. I appreciate that, because the transparency, I think, at agencies is important to members of Congress, of course. Nothing's more frustrating, and you know this because you were here for a while, when you work on legislation and then you see that it's implemented by an agency and you have questions about whether or not that has followed congressional intent. So if anyone understands that, it would be you. The No Surprises Act is clear that no later than 30 days after the claim is submitted to a health plan, that the plan must issue an initial payment or a denial. How will you protect physician practices in the event that health plans fail to respond to the claim, that the claim is being considered, respond to the claim that the claim is considered de facto accepted by the health plan? Does that make sense? I think I understand. Basically, how do you hold the plans accountable if they don't address the claim in a timely manner? Yeah, and that's where the dispute resolution process will be critical, because there have to be teeth, right? And you understand this, because at the end of the day, when a decision is made, there has to be follow through, especially by those that aren't providing the payment, the reimbursement. And so I hope what we'll be able to show you is that we come up with a system that actually is accountable and shows results, because at the end of the day, the public is not going to believe us that we meant this if we don't do it right. And while we keep them out of the dispute, at the end of the day, somebody has to get paid.
Gentleman's time is expired.
Okay. Thank you, Madam Chair.
Thank you. The chair now recognizes the gentlewoman from Michigan, Mrs. Dingle, for your 5 minutes of questions.
Thank you, Madam Chair and Ranking Member Guthrie, and Mr. Secretary. It's great to see you. I want to thank you for being here, and I really look forward to working with you on so many issues that we both care about, from the opioid crisis, the high prescription cost of drugs, to clean, accessible water. But today, I want to talk about strengthening our nation's readiness for the public health crisis. As you know, public health funding follows a pattern of panic and neglect, where large amounts of money are invested during a crisis, and then once the crisis is over, funding's not adequately maintained. I think that maybe this pandemic has opened our eyes to the deadly shortcomings of this pattern, and this committee has worked to not only shore up the current needs, but shed light on the realities of the needs to come, whether planned or not. So, Mr. Secretary, how is the administration's funding request for this year reflective of the department's effort to break this cycle and achieve long-term public health preparedness sustainability?
Congresswoman, great to see you, and critical question, because we saw through COVID how the stockpile needs to be modernized. I will say this. First, we have to make sure we've got the resources to make sure we've got the right amount of the supplies, that we have a supply chain that works. And so we're going beyond just putting product in storage and making it available. We're going to go into taking a look at how we actually distribute. We need visibility on that supply chain, and we need to have accountability as well. And as we discussed earlier, to the degree possible, we should make sure that Americans are providing the product that we're using in that supply chain. And so we're going to work as hard as we can. The resources come through. I guarantee you what you're going to find is that we are going to lift up the strategic national stockpile in ways that make it 21st century process.
That's great. And I think we need to bring that supply chain back to this country as fast as we can. And just as an aside, I'd also like to say that in this recent surge, my nurses still lacked from PPE supplies and did not have N95 masks. So the funding request includes $905 million for the strategic national stockpile for supplies and maintaining restructuring efforts initiated during the pandemic. What are the department's immediate priorities for the stockpile, and how will this funding be used for the critical improvements we need right now?
Congresswoman, some of that's pretty basic. We have to make sure we know what's in the stockpile. We have to know if it works. And we have to know if it really meets the needs of the 21st century crises and national pandemics that we might face. And so we have a lot of work to do. We have to make sure that we can work with the technology that lets us move instantaneously, because we know that it's not just a matter of having it in storage, it's getting it where it needs as quickly as possible, because lives are at stake. So it's essentially all of the above, but we're going to have to do a scrub to make sure the SNS is really working for Americans the right way. And so I look forward to working with you on this, because I think we've learned that this is going to be a critical component of being able to respond adequately and quickly to any future healthcare crisis.
I'm going to sort of ask you my last two questions because I don't have that much time, but I really want to work with you on this. I mean, what should we as Congress be considering as we conduct oversight on the COVID-19 response and consider possible legislation to address failures in preparedness? But also, as somebody who my district became the arsenal of health at the last minute, but there were startup problems, but they were doing both PPE equipment and the ventilators. What is there, how do we examine the role for more private-public partnerships in purchasing, securing, and stockpiling PPE? And what, if any, SNS capabilities can be better managed, maybe even at the state level than the federal level?
Congresswoman, I think we learned a couple of things. One, we need to have better communication and coordination with the state and local partners that we have. They need to have a better sense of what we've got in the stockpile, how it's going to be dispersed, what they can expect. We also need to work with them a little closer so they know that we have to know that there will be results. If they want something, we have to know it's going to go to the right people at the right time. And so we have to have far more coordination. There was a lot of disjoined activity occurring at the very beginning of this pandemic. And it wasn't clear, if the left hand was guiding the right or vice versa. We can't afford to have that happen. So better communication, better coordination, and stronger partnerships, not just with our local and state government partners, but with our private sector partners as well.
Thank you, Mr. Secretary. 24 seconds doesn't let me ask another question, so I'll yield back, but it's great to have you back.
Great to see you.
Madam Chair, yield back.
The gentlewoman yields back. We thank her. Pleasure to recognize the gentleman from Oklahoma, Mr. Mullen, for your 5 minutes of questions. Can you hear me? Am I unmuted? Am
No, I was on mute.
Oh, I see. Okay.
I started talking and I forgot to hit the little red button that says unmute. But
Okay.
Madam Chair, thank you so much. And Mr.
Sure.
Secretary, thank you for being here. Last Congress, we appropriated $47 billion for COVID testing. Do you know how much of those funds still are available?
Congressman, I don't have that number off the top of my head, but if you like, I could get back to you on that or your staff.
Yeah, I would appreciate it. We're just trying to figure out if, what the funds are going to be used for, or if Congress is going to need to reappropriate those dollars if we're not going to be testing, because I believe we, if I'm remembering this correctly, we appropriated an additional $50 billion was provided in March for COVID, and the administration is saying now they won't need but about $13 billion of that. Which that's we got 37 billion still sitting there. Do you have any idea, what the intent is going to be with your office on how to use those funds? Are you able to use it in a different way, or once again, is Congress going to need to reappropriate these?
Congressman, excellent question. And what I will tell you is that as you watch what's going on in India and we learn more about these variants that are popping up, we are not done. And no one should get any impression that we are done tackling COVID or whatever comes, the mutations that come from COVID. And so we have to continue an aggressive testing strategy. We have to continue to make investments to prevent the spread of COVID and its variants. And so I will tell you that while I can't tell you exactly how much money is there right now, and I can get back to you on that. And we can certainly make sure that we're keeping you abreast of what the plans are to make sure that we continue to tackle COVID and whatever comes next.
Well, I have no doubt, your dedication to tackling COVID. It's just, with that much money sitting there, what we don't want to see is it's just sitting there and it doesn't go away. What we have a lot of accounts throughout the government that money is just sitting there that Congress appropriated for, and it can't be used. So if there's a better way for us to appropriate it, for instance, as Ms. Dingell was saying with PPE, if we need to reappropriate it for the strategic stockpile, if we need to use it more focused on rural areas, and that's an area. If we need to go to take it to the border, I mean, right now, I think the president requested $4.3 roughly billion for a refugee resettlement camp. And I mean, kind of a question there, does that $4.3, does that account for what's going on with the Biden border crisis right now on the southern border and the influx of the illegal immigrants?
So I think you asked two different things here. If you want, I can, on the question about the resources for testing, I will tell you that we can stay in touch with you, appreciate your interest and concern. We are going to make sure that whatever resources we have, we will use not only appropriately, but transparently. And so we can stay in touch on how we're making the investments to keep Americans safe. On the issue of the border, Congressman, can I ask you to repeat that question one more time?
The reason why I was comparing the two is, do we need to reappropriate those dollars to what's happened on the border with the crisis that's taking place there? Because the president authorized $4.3 billion for the refugee resettlement. And with the influx of the illegal immigrants that's coming across and the high amount of those that are being detained and not being tested, do we need to reappropriate funds to go to that sector?
And Congressman, as you know, we at HHS, we have many obligations. One of them is to make sure we continue to test the American public for COVID. We will continue to do that, and we'll make sure that we're in touch with your office on the resources that it takes to do that. When it comes to the migrant children at the border, we have a responsibility to make sure that their well-being is cared for however long they might be in this country and whatever their ultimate status will be. Our job at HHS is different from DHS. We have to provide the care that we expect for any child. We will do that. Obviously, need resources to make that happen.
Mr. Secretary, it's not just that, it's the adults too. I mean, I fly through Dallas almost every week, and when you go through Dallas, what you'll see is someone walking around with a manila envelope and a card that says no English, and they're being shipped to wherever. And it could be the day before when they were actually apprehended on the border, and there's no way they can be tested that quick. And so before we're letting these people literally be deported or be transported, I mean, all over the United States, I think it'd be wise for us to make sure they're being tested. And there's no way they're being tested right now. And so that's why I'm getting at, should we reappropriate those funds to go towards those testing?
Well, I would question the premise that they're not being tested, but I want to make sure that it's clear we have to put the resources where we need them. And at HHS, whether it's the testing issue or with the children at the border, we have put together a responsible proposal to get both of those things done.
Right, I'll yield back, but I would check into the testing.
The gentleman's time, yeah.
Thank you.
The gentleman's time has expired. The chair is pleased to recognize the gentlewoman from New Hampshire, Ms. Custer, followed by Mr. Hudson. So you are recognized, Annie, for your 5 minutes.
Thank you so much, Madam Chair and Mr. Secretary. Wonderful to be with you, and thank you for your testimony today. Welcome back to the People's House, and congratulations once again on your confirmation as our Health and Human Services Secretary. The funding request for HHS put forward by the Biden-Harris administration is exactly what we need in this moment to address the many challenges facing our country. One challenge I look forward to working with you and other HHS agency officials on is how we can address the increasing number of drug overdoses and expand access to prevention, treatment, and long-term recovery services for those suffering from substance use disorder. An important priority of mine this Congress is identifying ways to expand access to care and treatment within incarcerated settings. Last Congress, Senator Booker and I partnered on new bipartisan legislation, the Humane Correctional Healthcare Act, which would allow Medicaid to follow our justice-involved population during their time in federal prison in order to provide much-needed mental health and substance use treatment. A catalyst to our recidivism crisis is that our justice-involved population does not receive adequate health care, particularly when it comes to treating mental health and addiction, leaving these vulnerable Americans with the same substance misuse disorders when they leave prison as when they arrive. And we all act shocked. We're not shocked when they go back to their diabetes. We shouldn't be shocked that their untreated mental health and substance use problems persist. Senator Booker and I are working on reintroducing partisan legislation. I'd welcome the opportunity to work with your department and CMS on this critically important public health issue. Now, with respect to the HHS budget, I was pleased to see it includes $10 billion across your agency to combat the substance misuse epidemic, which I understand is nearly a $4 billion increase over the past fiscal year. I applaud this bold investment. I want to ask about your goals for this funding. Secretary Becerra, this is a significant amount of funding proposed to fight the drug epidemic. How will this be spread across your agencies, and what actions do you plan to take with these investments?
Congresswoman, wonderful to see you again, and excellent question. And if we're able to continue with the resources that we've seen so far, and thank you for the help in getting some of those resources in the American Rescue Plan, we will be able to let SAMHSA at HHS really take the lead to try to address some of these concerns. And we know because of COVID, it's an even sharper concern. Some 81,000 Americans died this past year from drug overdoses. And I think that's the largest number we've seen in quite some time. And it's clear that there are a whole bunch of Americans who are very stressed and they need that assistance. So we're going to get out there and work with our state and local partners as best we can. But SAMHSA will take the lead, and we will try to supplement what we can with the resources that our state partners have. We're going to try to be innovative. I will tell you that. We're going to try to make sure that we allow for those medically assisted treatment programs to get out there and do their job. We want to make sure that Americans know, especially our young population, know that we want to catch them. We want to catch them before they fall completely. And I think working with you, we can make a real dent in this and prove to Americans that we are serious about tackling this.
Well, thank you. And on behalf of all the members of our bipartisan addiction and mental health task force, we look forward to working with you as well. We know that only a fraction of patients with substance use disorders have access to evidence-based treatment. Can you discuss how the department will improve access to evidence-based treatment, including in rural communities like my district in New Hampshire?
And that's where, Congressman, as I mentioned, it's important that we work with our state and local partners because they're the ones that are going to be implementing on the ground. I will tell you, in my former work as the Attorney General for our state of California, we worked very hard to get to the point of actually having a major settlement with some of these drug manufacturers and drug distributors of opioids to try to help make sure we put money into our communities to address the abatement needs of a lot of these jurisdictions that are going to try to go out there and provide services. If we're smart, we're going to work closely with our partners to make sure that they take that settlement money, we take the money that's coming out of the American Rescue Plan, and we're applying it so that we're actually providing on-the-ground services quickly to a lot of our families. And so we have an opportunity to do something we haven't done in a long time. That is actually make a dent in this crisis.
Well, thank you so much. And with that, I yield back.
The gentlewoman yields back. We want to put more than a dent in it. We have dents, but we under your leadership, we want to rid ourselves of this. The chair now recognizes the gentleman from North Carolina, Mr. Hudson, for your 5 minutes of questions.
Thank you, Madam Chair, and Mr. Secretary, welcome. Thank you for your time today. Like many Americans, I'm concerned about the worsening crisis on our southern border. The data shows that crossings, unaccompanied minors, and drugs like fentanyl encountered at the border are at record highs. In fact, it was just reported by Border Patrol that apprehensions in April reached the highest total in 20 years. I recently visited the border and saw this humanitarian, public health, and national security crisis firsthand, specifically at the Donna migrant facility designed for 250. They were holding 3,500 children inside. I hope you agree this is a real crisis. And it appears the government's running out of capacity to house more than 20,000 minors, a record high number. This week, I read a report that HHS is considering sending hundreds of those unaccompanied minors to a North Carolina city. And Madam Chair, I'd like to enter into the record an article from the Washington Examiner entitled "The North Carolina City Could Be Next to House Unaccompanied Migrant Children." Mr. Secretary, can you confirm if this report is true? Have you already sent or are you planning to send minors to North Carolina?
Congressman, thank you for the question. And first, let me respond by saying that we are always trying to make sure that we are providing a safe and a legal shelter for the kids who are in our custody. And so we do, and as you mentioned, there's several thousand of them, because it's our responsibility to take these kids from the Customs and Border Patrol detention centers and actually provide them with the type of housing that is expected for a child. But I will tell you that there is no plan that we have to shelter children in North Carolina. We are always looking for sites where we can provide the type of safety and security that children need. And we have sites throughout the country, but there's no plan that I could tell you right now to shelter children in North Carolina.
Thank you for that answer. Currently, if an American citizen wants to fly from Mexico to the United States, we're required to have a negative COVID test first. Before your agency sends migrants to some of these locations you mentioned around the country, when you receive them from the Border Patrol, are they being given a COVID test before they're put in public transportation?
Congressman, they are absolutely being checked because the last thing we can afford to do is have a spread of the virus at the locations where we are housing a number of these kids. And as you probably are aware, we have them in quarters that are quite tight at times. And so we have to protect their safety and the safety of the Americans who are working with them. And so we absolutely make sure they are tested before they come to us.
So 100% of these minors that you're receiving of the 20,000 are being tested before they leave from the border location to enter the other places in the United States. 100% are being tested.
Absolutely.
Well, that's comforting. I appreciate that. And so in March, I sent a letter to our North Carolina governor and to DHS secretary because there was an article that was saying that migrants were not COVID tested, and some that actually were tested and tested positive were then being put on buses. And one of the individuals being interviewed for this story said that he had a ticket to leave the next morning for North Carolina. And so that's really where my concern is coming from, that these individuals, if they are testing positive, are being put on transportation anyway. Could you tell me, when you were testing these unaccompanied minors, if they have a positive test, what is then being done with that individual?
Great question, Congressman. We have to make sure we isolate them from the rest of the population, which is one of the reasons why it's been such a tough assignment, because we have to make sure we have the space to accommodate these kids. Remember, we are still under a legal obligation as a government to move these children out of CBB's custody within a certain amount of time, 72 hours. And so whether the child is positive or not, CBP is under a mandate to move them, and they come to us. And so we have to make sure that any child is safe. If there's a COVID positive child, we have to make sure they're safe, but that they're also not spreading the disease. And so we make accommodations, which is not easy, it's not cheap, but we do it because that's the right thing to do.
Well, what I learned at the border at the Donna facility is there were children who'd been there 28 to 30 days. And so I imagine, I'm hopeful that you're able to comply with the law. At the time, that wasn't happening.
And I just to give you a sense, as of yesterday, there were 0 children in Custom and Border Patrol custody who had been there more than 72 hours, more than 72 hours. 0 kids. But you're absolutely right. There was a time when they had in their custody quite a few, but that has now changed. The average time that a child is now in Custom Border Patrol custody, 25 hours. And so, Congressman, what I can tell you is we at HHS have worked very hard to make sure that not only do we relieve the pressure that CBP was under in housing these kids, but we do it the right way. We do it legally, we do it responsibly, and while it takes some money and it takes some time, we're going to do it right.
The gentleman's time has expired. Thank you, gentlemen. Thank you. The chair is pleased to recognize the gentlewoman from Illinois, Ms. Kelly, followed by the gentleman from Georgia, Mr. Carter.
Thank you, Chairwoman Eshoo, Ranking Member Guthrie, for your leadership and opportunity to serve an informed discussion on the Department of Health and Human Services budget priorities. Secretary, it's always good to see you. Thank you for testifying before the committee today. I would like to discuss the issue of maternal health and maternal mortality in the United States. As noted in the administration's budget request, the U.S. has one of the worst rates of maternal mortality among developed countries in the world. In 2017, the U.S. recorded a maternal mortality ratio of 17.4 deaths per 100,000 pregnancies, ranking last among industrialized countries. The numbers are far worse for Black women. In the same year, Black mothers experienced a maternal death ratio of 37.1 deaths per 100,000 pregnancies, more than twice the rate of white mothers. The causes of death vary, but it's clear there are widely inequitable outcomes for maternal health in our country. I fully support your request to increase investments in maternal health. The HHS funding proposal requests increased funding for maternal mortality review committees, rural maternal health care, implicit bias training for clinicians and health workers, and state pregnancy medical home programs. Many of these proposals have also been priorities for the ENC committee, and I believe these provisions are critically important to addressing the maternal health crisis. Secretary Becerra, improving maternal health outcomes requires accessible, quality preconception, prenatal delivery, and postpartum care. How could the investments the administration has requested improve maternal health care and narrow these persistent inequities we see in maternal health outcomes?
Congresswoman, great to be with you, and thank you for the important question. I'm glad you asked this question because too many Americans don't realize that we have a maternal mortality crisis in America. It's just that it's hidden. It only occurs in certain communities, but it is a crisis. And we are going to tackle this, and I hope that we are able to work with you and others who are interested, because we're going to use an evidence-based intervention approach. We're going to go where we know the crisis exists. We're going to use the types of procedures and treatments that we know have worked. By the way, my wife will salute you for having asked the question as a high-risk perinatologist, essentially dealing with these types of crises. She wants to know that we're making the investments. And what we're going to do is go into the communities. And by the way, part of this is not just on the medical side. Part of this is just making sure a woman has access to the type of information and services she needs during the pregnancy to make sure that she doesn't end up having a crisis on delivery. And so we're going to work closely with those who know how to do this. And I guarantee you, we're going to make a difference. That $200 million is going to be money well spent.
Thank you. Last Congress, the House passed the Maternal Health Quality Improvement Act in an overwhelmingly bipartisan fashion. The bill included grants for implicit bias training, similar to the proposals in the budget request, as well as additional provisions to address rural maternal health and training for healthcare providers. Unfortunately, this bill did not become law last Congress, but I continue to believe these policies are critically important. Can you discuss the value of implicit bias training for healthcare providers, especially in the context of maternal health?
And here's where Carolina, my wife, could do a far better job because she has actually witnessed this. But what she would tell you is that oftentimes when a woman, especially a woman, but it can be anyone, comes in, if you don't have a provider, a physician who has, or other kind of provider who hasn't really experienced the type of circumstance that some of the patients come in with, it is tough. And we use these biases that we don't even know about, these implicit biases, to make judgments and decisions about the healthcare for these patients. And so what we need to do is just understand that we need people who have that sensitivity. We have to provide the training, but more than that, we have to give the patients some control over this to make sure that they know where to go to get the care that they need. And that's where, if we tackle implicit bias the right way, what we're going to do is actually ensure a better outcome for not just the patient, but if it's a woman who's pregnant, for the future of our country.
Any other additional policies you want the committee to consider?
Well,
You can
I
always
would.
send them on if you don't have it off the top of your head.
But listen, Medicaid has been relied on by so many of these mothers that we're talking about. If we could just make sure that we continue to support Medicaid, continue to urge some of those states that have not expanded their Medicaid to do so, we would really be dealing with this. And remember, we have now put a challenge out there. If there are states that want to expand care postpartum for a woman from 60 days to a year, we're with them and we'll provide them some additional support.
Well, thank you so much. I look forward to working with you. Proud to say Illinois was the first state to do it. So with your help, thank you so much, and I yield back.
The gentlewoman yields back, and Mr. Secretary, no member of the House of Representatives has done more on this issue than Ms. Kelly. So she's our leader on this. I understand that 2 Republicans, Mr. Carter of Georgia, Mr. Dunn of Florida, are not going to be questioning. So I'm going to move to recognize Mr. Curtis of Utah for your 5 minutes of questions, followed by Ms. Barragan of California.
Thank you, Madam Chair and Mr. Secretary. It's nice to be here with you today. I regret I've not been in Congress long enough to know you from your DC life, but it won't surprise you that you made a few headlines as Attorney General in California, and I've heard of you. In that role, you've led a charge against the previous administration's efforts to expand access to association health care plans, and I'd like to discuss those for a minute. Although you've led that charge, research shows that premiums in states that allow these plans decreased, enrollments in ACA exchange plans increased, and the number of new plans offered in these marketplaces increased by 61%. Those are all good numbers. However, the individual marketplace prior to the actions taken by the previous administration, which you oppose, tell a different story and show an increase in premiums by 105%. Would you agree that overall, philosophically, more plan offerings will strengthen our healthcare system and drive down cost, which is clearly the case here?
Congressman, first, I welcome the opportunity to get to know you and work with you, and thank you for the question and the thoughtful way in which you posed it. I will tell you that we want to make sure that Americans have a choice, lots of choice, right? but we want to make sure that when they choose, they're getting something that has value. And so whatever the source, however it's put together, we just want to make sure that Americans have choice of plans that offer real benefits.
I certainly can't disagree with that statement, but I do feel like sometimes that those of us make value decisions for other people, and that sometimes we need to let them make their own informed decisions. Now, let me just shift gears slightly. You've continually called for the ACA expansion while calling short-term plans junk plans. We've talked about that a number of times in this hearing. Despite this, the ACA plans have notoriously limited patient choices by cutting provider networks and implementing strict prior authorization standards, which only harm our most vulnerable patients. Isn't this just another form of health discrimination? And what would you say to rare disease patients with ACA plans who lost access to life-saving care because of these actions?
Congressman, I bet you if you and I sat down, we would find that we could agree on this issue, because at the end of the day, we're looking for comprehensive plans that have quality coverage for all Americans. And there is, under the Affordable Care Act, a place for some short-term plans, but it's truly short-term plans for those who need short-term care, who are in between jobs, for example, or who are going overseas for a little while and don't have the luxury to have a plan that's long-term because you only need it short-term. So there's a place for that. But I think you and I would agree, it's about quality and about making sure it's affordable for people. And the way you do that is to make sure that what they're getting is what they thought.
Well, let me be the first to invite you to Utah in your new role. We would love that conversation and would love to have a thoughtful dialogue with you. And I can promise you a delightful experience out in Utah when your travels take you out that way. Let me, speaking of Utah, I have a very, very large rural part of my district. About 80% of my geography is rural, but only about 10 or 15% of my constituents. Telehealth has played just an amazing critical role during the pandemic. There's an increasing sense that I'll say the train has left the station and these expanded services should be made permanent. I'm also aware that private insurers that have committed to permanently reimburse for telehealth services plan to that end. What specific plans do you have for HHS related to telehealth as states reopen again? And what role do you see for Congress in making these plans permanent, especially for our seniors?
Congressman, I think just about everything you just said on telehealth, I agree with. I would add a little bit. We've learned a lot from COVID on how to do this. We want to make sure we offer flexibility, but we want to make sure that we don't leave anyone out. And so it's a matter of making sure that we understand that telehealth requires broadband. There are certain communities, especially rural communities, that don't have access to good broadband. It's going to take resources to make sure that happens. Some parts of the country already can use telehealth, but what we don't want to do is find the inequities that we found as a result of COVID, where we leave certain communities, rural or poor, behind. And so we can do this, working together, and it will take your effort, because some of these things we can do administratively, but a lot of it will.
I'm going to run out of time, but I want to just tell you, it's as if we teed each other up, because I wanted to talk broadband with you, and we're just hopeful that you would support broadband as we reform it and make it so it's more accessible. And Madam Chair, 0 seconds left. I yield my time.
Excellent job, Mr. Curtis. The gentleman yields back. Pleasure to recognize our California colleague, Ms. Barragan, for her 5 minutes of questions.
Thank you, Madam Chair, and thank you, Mr. Secretary, for joining us here today. Just to chime in a little on the conversation about migrants at the border. I was just at the Donna facility last Friday. There's been remarkable progress with a almost 80% decline of kids that are now in Border Patrol custody. And that's why I want to applaud you, Mr. Secretary, for the work that you have done with HHS to get kids out of custody of Border Patrol as quickly as possible. When I was at the Donna facility, which again is a Border Patrol facility, there was no child there over 24 hours. So that has just been a success of the administration on their willingness to take action and to not have kids in Border Patrol custody. And I did visit some of the HHS facilities. one there at Delphi, and of course, the one in Long Beach, right next to my district. One, Mr. Secretary, I know you're visiting soon, to see that not only are children being tested before they arrive, but they're being tested for COVID throughout the entire week there. And so it's a great that you're able to visit that facility and see firsthand. Mr. Secretary, I want to move on to a couple of issues that are near and dear to me. One is the issue of social determinants of health. We saw as a result of the COVID-19 pandemic that communities of color were hit very hard. And we've also seen that how a community's resources directly impact the health of its residents. Unsafe or unstable housing, food insecurity, a lack of transportation, all these things put some populations at higher risk during this pandemic emergency. Addressing these social determinants of health is crucial to reducing health disparities, not only during the current crisis, but we must work to strengthen our public health infrastructure into the future. I was excited to see that President Biden's budget request $153 million to the CDC Social Determinants of Health program, which was modeled after my bill, the Improving Social Determinants of Health Act, or HR 379, which supports state, local, territorial, and tribal health agencies address these underlying issues that contribute to inequity. Mr. Secretary, can you talk about the administration's commitment to addressing social determinants and why you believe funding programs, including at the CDC, is crucial in addressing disparities?
Congresswoman, thank you for the question. Great to be with you, and I look forward to working with you on this particular issue. I know this is a lifetime commitment for you as it is for me. We're not only going to take the resources that the president wants to make available to us, but I have made it very clear throughout the department here at HHS that equity will permeate everything we do. So it's not just in the programs that we're trying to administer or create, it's in everything that we will do at HHS. We take into account that we have to remember those who have oftentimes been left in the corners. And so those social determinants of health, by the way, we need good data to know what those determinants are. We have to make sure we're collecting good data. We have to make sure we're working really hard with our local partners to make sure they also get it, that equity should be at the forefront of what they do. And if you'll give me a second, Congresswoman, I'd like to just say thank you to you for your efforts and help in making sure that the Long Beach site that we're using for some of these unaccompanied migrant children is not only working, but working well. And I think I have to tip my hat to the people at the Health and Human Services Agency who have been doing just a phenomenal job in making sure we do it the right way.
Well, thank you. Thank you, Mr. Secretary. I was excited to hear that the president discussed ending cancer as we know it during his joint address to Congress. I wish to take a moment to highlight one form of cancer, multiple myeloma. Unfortunately, my sister, who's only a year older than me, last November was diagnosed with multiple myeloma. It was pretty devastating for me and my family, and of course, to her and her family. This is a cancer that is a type of a blood cancer. Let me back up here. Multiple myeloma is a cancer that forms in a type of white blood cell and accumulates in the bone marrow. In 2021, it is estimated that there will be 34,920 new cases of myeloma, and an estimated 12,410 people will die of this disease. Unfortunately, large socioeconomic, geographic, and racial disparities exist in myeloma treatment, which can greatly impact patient outcomes. Among these disparities include delayed diagnosis, stem cell utilization rates, limited access to new therapies, and access to clinical trials. I just wanted to put this on your radar, Mr. Secretary, so that we can make sure we're looking at things like multiple myeloma when we're looking at where to invest the $6.5 billion. And I also want to applaud the administration and you for looking at climate change and making sure that we are looking at this as a public health crisis and addressing that as well. And with that, I yield back.
The gentlewoman's time has expired. It's a pleasure to recognize Dr. Joyce of Pennsylvania for his, am I doing this right? Yes. Dr. Joyce, you're recognized for your 5 minutes.
Thank you, Chair Eshoo and Ranking Member. This is a great opportunity to be with you here today, Secretary. I'd like to return to some of the remarks that you made earlier when it didn't seem clear that you understood what my colleague, Mr. Bilirakis, meant by the term partial birth abortion. And I think that it needs to be defined as it is in statute. Section 1531 of Title 18 U.S. Code is literally titled partial birth abortions prohibited. Partial birth abortions prohibited. That statute very clearly defines that this inhumane procedure in Section B, subsection 1. So now with that clarification, could you please recognize that that does exist in statute? And I would ask you, do you agree that this law is correct?
Congressman, thank you very much, and thanks for trying to clarify. I think I understood the question, and I think I understand your question as well. What I'm trying to explain is that the term partial birth abortion may be recognized in politics and by politicians, but it is not a medically recognized term. Perhaps if you were to talk about what you probably know as dilation and extraction, which is a procedure used by OBGYNs like my wife to care for a woman who is having a difficult pregnancy, where there's a chance that the fetus will not survive, then we can talk about that. But what I'm saying to you is that under the law, a physician or any provider of healthcare must make sure that he or she abides by the law. And right now, what our law says, and it's pretty settled, is that a woman is entitled to reproductive rights. And so my question is not so much with the term partial birth abortion, it's with what the rights are of a woman under our statutes and under our precedents to provide her with reproductive care that she's entitled to. And as my wife would tell you as an OBGYN, is that the dilation and extraction procedure that is often used, late stage abortions for women, it's to protect the health and life of that woman.
So just for further clarification, partial birth abortions are prohibited right now under current statute, and that is something that you recognize, correct, Mr. Secretary?
Congressman, as I said, I recognize that the law provides women with reproductive rights, and that the Roe v. Wade decision made very clear under what circumstances women can exercise those rights. I will do everything I can to make sure we comply with precedent and the law when it comes to protecting a woman's right to her reproductive health.
And that does include enforcing this statute, correct?
I will make sure that we are providing women with the protections they need on their reproductive rights. And again, with all due respect, I know that this is a very sensitive issue for a lot of folks, but I think most medical practitioners will tell you they understand what a dilation and extraction procedure is. I doubt that most of them can give you a medical definition of what partial birth abortion is.
As a physician myself, Mr. Secretary, I think I clearly understand what a partial birth abortion is. Let's move on at this point in time, please. And I see we're narrowing down. During your tenure as a California Attorney General, you sued the federal government to protect a California regulation that required churches to pay for abortions in their healthcare plans. You also sued the Little Sisters of the Poor, seeking to force a Catholic group of nuns to pay for contraception and abortions. During your confirmation hearing, you stated that you would recuse yourself from participating in matters related to litigation you pursued against the federal government. Would you provide for us a list of every matter from which you would personally recuse yourself?
Congressman, first to respond on the actions that I took as the Attorney General. Again, as I said, I respect that there are different deeply held beliefs on the matter of abortion. And what I did when I was Attorney General was comply with the law and enforce the law. But I will say to you, to correct the record, I never sued any nuns. I never sued any organization that had religious exemptions. What I did was I took actions to make sure that providers who are under obligation by law to provide services to all people, including women who are pregnant, did so. And so, however it might be described, the reality is that I simply protected the rights of Americans to get the health care that they're entitled to under the law. I forgot now the second part of the second question that you had.
The second part asked you to include a list of any matters that you personally would recuse yourself because of previous litigation.
Yeah, and I made it clear when I was getting confirmed that I signed an ethics agreement not to involve myself directly with any matters in which I was directly involved in litigation as Attorney General for the state of California.
Right, and the gentleman's time is expired.
Thank you.
Chair now, thank you. The chair now recognizes the gentlewoman from Delaware, Ms. Lisa Blunt Rochester.
Thank you so much, Madam Chairwoman and Ranking Member. And thank you, Secretary Becerra, for joining us and presenting the administration's Fiscal Year 2022 funding request for HHS. As a former Delaware Deputy Secretary of Health and Social Services, State Personnel Director, and CEO of our Urban League, I understand all too well the challenges you would face under normal times, but your leadership during this pandemic is critical, and we are so fortunate to have you in your role as we recover and rebuild. I'm also pleased to see our shared focus and priorities of strengthening outreach and enrollment in the ACA, a focus on the social determinants of health, telehealth, value-based healthcare systems, and systemic equity to improve outcomes. And I look forward to working with you. Today, I want to focus on an issue that has disproportionately affected communities of color, climate change. For decades, policy decisions at the federal, state, and local levels have led Black, Brown, and Indigenous communities living near toxic and polluted environments, even though the link between these conditions, air pollution, and increased rates of illness like cancer and asthma is well documented. The administration's funding request proposes establishing a new Office of Climate Change and Health Equity to reduce disparities in communities of color, low-wealth households, tribal communities, and other marginalized groups overburdened by the health impacts of climate change. Mr. Secretary, can you discuss how this office will differ from existing HHS agency efforts around climate change, such as the NIH Climate Change and Human Health and the CDC Climate and Health programs?
Congressman, thank you for the question, and I absolutely appreciate the chance to respond to that. We're going to focus directly now, as a result of these resources, on climate change. By the way, I should mention that as Attorney General, I established the Environmental Justice Bureau in our department because we know, as you've sort of said, it is our communities that are first and worst hit by climate change. And so we want to get there before the hit gets there. And in order to do that, we have to have the resources to start letting people know about clean water, about asthma when you have dirty air, about those toxic sites that might be built in your community, about the impact of building a large warehouse right next to a school and residential communities where you're going to have semi-trucks driving 24/7 right by all those communities spewing diesel gas, diesel exhaust. And so we're going to get out there and work with communities to make sure we provide equity, but more importantly, we fight to protect the health of these communities.
And how does this proposal build on past presidential initiatives to tackle the disproportionate impact of climate change?
Well, the most important way is it actually has money behind it. And that gives us a chance to really do something. You can always talk. You just have to have the resources and the fuel to walk. And we intend to walk our talk.
Excellent. And my last question, I'm going to kind of combine two. I want to talk a little bit about why the administration views it necessary to focus on health equity, and also talk about what agencies or organizations will you seek to partner with through this office.
So COVID-19 exposed the worst parts of our system, where we missed people. I mean, they were hiding in plain sight. You and I know that. And now we see it. And so now we have an obligation to do something about it. And I think what we will do differently is we're not going to just rely on the traditional sources of support. We're going to go directly to these communities that have been worst hit, first hit, and ask them, how can we help? Because we know you've had to live this. And for the first time, I think we can say we're going to bring some real resources behind what we want to do.
Excellent, excellent. Thank you so much, Mr. Secretary. Again, we're looking forward to working with you on this issue as well as so many others. I was fortunate to work to push for marketing and outreach in our More Health Education Act in the last Congress for the ACA. And I'm so glad to see the efforts that the administration has made, especially during a pandemic, to ensure more people have access to healthcare. And I'm looking forward to working with you on other issues as well. Thank you. And Madam Chair, I yield back my time.
Excellent. The gentlewoman yields back. Pleasure to recognize our resident pharmacist on our committee, Mr. Secretary, the gentleman from Georgia, Mr. Carter, for 5 minutes.
Thank you, Madam Chair, and thank you, Mr. Secretary, for being here. Mr. Secretary, it's been almost 14 months now since the COVID-19 pandemic started, and it began in China. We know that, but we still don't know the origin as far as whether it started at the wet market or if it started at the Institute of Virology, and we haven't even had an investigation into telling us this, and we need to get to the bottom of it, obviously, and I'm sure you agree with that. We need to know so that we can prevent this from happening again. That's crucial. I want to ask you very quickly, can you just give me your perspective on how the U.S. and the global community, because this in fact impacts all of us, how the global community can hold China accountable and ensure that a credible investigation into the origin of the COVID-19 can be conducted?
Congressman, thank you for the question. I agree with you. We want to make sure that there is a transparent process that's based on evidence that helps guide us in trying to take a look at this and dig down deep. We want to have accountability. We are now back on stage with the World Health Organization, working with them, and we provided some guidance to them on what we think would make for a critical, thorough, comprehensive review of the circumstances behind COVID-19. And so look forward to partnering with you as we try to work with our international partners to make sure we get to the bottom of these things.
Do you think that China and the World Health Organization should be pushed to allow an investigation into the possible origins, whether it be the wet market or the lab?
Well, we've already been pushing the WHO in trying to make sure that we do a thorough assessment of this. We have been in communication with China on any number of issues relating to COVID, and we're going to continue to push, because at the end of the day, I think you'll agree with this. We have to understand how COVID surfaced. We have to understand how it spread, so we can try to make sure we're prepared for the next time we have this kind of a public health crisis.
Okay, Mr. Secretary, in 2017, this committee, the Energy and Commerce Committee, was instrumental in enactment of legislation that would allow consumers to have access to over-the-counter hearing aids. And it was bipartisan legislation, as is often the case out of this committee. I submit that this is the most bipartisan committee in Congress. And on the bipartisan basis, the House and the Senate repeatedly inquires of the FDA on the status of this regulation. But ever since last year, month after month, the FDA just says it's a priority, but we can't tell you where the regulation is at. I'm hearing, and I've been told, that there are rumors that the regulation can't move until we have a permanent FDA commissioner. Is that true?
First, that's not true. And secondly, if I can just say that my mom doesn't live in Georgia, but if she did, she'd vote for you right now, because she's one of those victims of these hearing aid marketing schemes, and is anxious to hear my answer just as you are. And so I look forward to working with you, because we're going to get that out. We don't have to wait till we have a permanent commissioner. It is an important rulemaking. And we will work closely with you on trying to make sure that Americans, if they're going to participate in purchasing these hearing aids, they get what they're supposed to get.
Do you have a date certain that you can tell me? I mean, is it?
I said, if I could tell you a date certain, I probably would have to give folks a date certain on a lot of other matters. We're working on it, but I can tell you, I think my mom is probably going to push me harder than you are on getting a date certain.
Understood. Understood. Is it still undergoing review with HHS, or have you finished your review, and has it gone to OMB yet?
It's still undergoing review.
Any idea when that'll be completed?
I could get back to you on that, Congressman.
Please, if you could get that to me in writing, I would appreciate that very much. Very quickly, I wanted to ask you, antimicrobial resistance. This is a major problem, and it's a major public health, and it's a national security threat. The CDC estimates almost 3 million Americans suffer from antimicrobial resistant relevant infections, and annually we have over 48,000 deaths resulting from those infections. And we've seen with the COVID-19 pandemic, as it continues, that a sizable number of patients are suffering from secondary infections, with the CDC identifying resistant secondary infections outbreaks as COVID-19 units. This reinforces, in my opinion, the urgent need for access to effective antimicrobial products as part of our pandemic preparedness and response. Can you commit to me, Mr. Secretary, that working together to address the antimicrobial resistance in a way that creates pull incentives for the development of a new countermeasure?
Absolutely commit to that. I think all of us are deadly afraid of what happens if we overuse some of these medicines and we're not prepared in case there is this resistance that does develop. And so absolutely look forward to working with you on that.
We need to work with that, but we also need to work with the overprescribing of certain antibiotics as well. As a pharmacist, I can tell you that was a problem. Thank you, Madam Chair, and I yield.
Yeah, the gentleman's time has expired. The chair is pleased to recognize the gentlewoman from Minnesota, Ms. Craig, for your 5 minutes.
Well, thank you so much, Madam Chairwoman. And Mr. Secretary, it's great to see you again. The last time I saw you in person, we were in Eagan, Minnesota. So it's great to see you. I want to start just by saying thank you. I can't tell you how pleased I am about yesterday's announcement that HHS will enforce civil rights protections for LGBTQ Americans related to healthcare. So thank you so much for your leadership and the administration's inclusion as a matter of policy. Also, as I listen to your testimony here today, it's all of the reasons and thinking behind why I'm here. That is, we've got to have a robust funding program for the NIH, for CDC, restocking the national stockpile, addressing maternal mortality and morbidity. All of these things is exactly why it's such an honor to serve on the Health Subcommittee in this Congress, and I'm just so proud of your leadership in this administration. Beyond all of that and the funding for these agencies and making sure that we have world-class innovation coming out of them, my top priority in Congress is to lower the cost of healthcare and prescription drugs and improve access for all Americans. Last month, I was proud to reintroduce a bill called the State Healthcare Premium Reduction Act. That would provide HHS with funding to help states set up reinsurance programs or extend financial assistance to folks on the individual market. We all know that that remains a critical issue, lowering and stabilizing the cost of healthcare out there in the individual market. According to the CBO, this bill would actually lower premiums by about 8% in the individual market. Secretary Becerra, do you have any comments on that as a policy matter, and does HHS support, just as we did for a few years at the beginning of the Affordable Care Act, helping states with federal funding to set up those reinsurance programs and lower premiums in the individual market?
Congresswoman, great to see you, and absolutely agree with what you said. We need to have a stable market. Reinsurance is one of the ways that we can help make sure we do.
Well, thank you so much for that. Reinsurance obviously is just one tool that we can use to shore up the ACA and to make sure that healthcare is more affordable for hardworking Minnesota families. Next, I want to turn to the American Rescue Plan for just a moment, which included health insurance premium assistance for so many Americans at a time when they're struggling financially. And I want to give credit to my colleague and classmate, Representative Lauren Underwood, for her championing and persistence in making sure that this was part of the American Rescue Plan. The landmark legislation extended ACA subsidies to more Americans, including for the first time, individuals with income above 400% of the federal poverty line. I also just want to take a moment to give this administration credit for reopening for that special enrollment period during a public health crisis, the ACA to Americans. So, Secretary Becerra, can you just briefly discuss the impact of the enhanced subsidies on premiums and how many individuals you've seen already with their monthly premiums decrease?
Congresswoman, the fact that there are 1 million new enrollees to the Affordable Care Act during the special enrollment period shows what happens when you give them a chance to learn that they can save money. And that was because of what you all did with the American Recovery Plan by giving us a chance to reduce the cost of their premiums. Now, the American Family Plan, which we hope that you will get to as well, will make permanent those savings that those Americans who are signing up for coverage are getting. And what's great is if you get 4 million more Americans coming on board because they too will save money, guess what you've done? You have just put a major, and to the chairman's thinking, more than just a dent in the uninsured in America. You are really going towards getting us to the point where every American can really say healthcare is a right, not just a privilege.
Secretary Becerra, you read my mind because that was my last question to you about making that permanent. So thank you so much. In the time that I have remaining, I just want to note that the importance of the 340B program, how important that is for providing access to care for low-income and rural patients in my district. I'd encourage you to take swift action to protect that vital program. And with that, Madam Chairwoman, I yield back.
The gentleman yields back. It's a pleasure to recognize the gentleman from Texas, Mr. Crenshaw, and it's great to have you with us. You're recognized.
Thank you, Madam Chair. Always great to be with you as well. Wish I could be with all you in DC. But you know, I guess that's a small benefit of this surgery. You can't go to DC for 6 weeks. But I do miss you guys. Mr. Secretary, thank you for being with us. I want to follow up on Dr. Burgess's questioning on the situation with Texas and our 1115 waiver, and I want to drill down as to why this happened. So this was a long-standing waiver, the extension of which was rejected by a career staffer at CMS who was temporarily head of CMS. It doesn't seem likely that they just took it upon themselves to reject that waiver. Who told them to do that?
Congressman, I wish you well and get back to DC, although I imagine you're not being in DC and getting to stay in your home state. But on the question of the waiver, again, I think it's important to recognize that Texas still has its waiver. Its waiver, it continues in force. Nothing has changed. What we're talking about is an extension of 10 years that was added to the existing waiver without public comment and without notice. And that's extraordinary when you think about it, given that it was a 10-year waiver, not a 5-year or shorter waiver. And you're talking about billions of dollars. And so what CMS is doing is what you would expect CMS to do, is we're trying to make sure that we're transparent and we show accountability, because we have to make sure we're following the law. And we're working with your leadership in the state and along with your delegation to try to make sure that as Texas moves forward, if it wants to continue the waiver, we're going to be working with you to make sure we can see that happen.
Okay, so it had your full approval to revoke that waiver that was approved by the previous or revoke that extension that was approved by the previous administration. It had the White House's approval, your approval. It wasn't some staffer that went rogue.
Well, I can guarantee you that there is not a staffer that's going rogue. But remember, much of the work that was done before I was confirmed. But what I will tell you is I concur with the actions that were taken by CMS in looking closely and working with Texas to look closely at the waiver that they've asked for as an extension. Again, the existing.
Well, look, I mean, we understand there might be disagreements on the interpretation of the powers under COVID, right? They approved it in a fast track way under COVID. That's what happened. Your administration disagrees with that interpretation. So be it, but to revoke an entire waiver, which has a massive effect for the future of Texas programs. I mean, it puts us into a very difficult situation because our entire system is predicated on this particular waiver, and it's a long-standing waiver too. You know, it's an extension of a long-standing waiver. This isn't some extreme thing. What is extreme is revoking an extension, which has never been done before. So, you know, if you have a procedural issue with it, I get that, but to take such an extreme action as a result is really hard for Texans to understand. And can you commit right now that if they resubmit, that it'll get approved?
Well, we're closely working with Texas to make sure if they wish to resubmit, they can. But Congressman, I would have to say that anytime you're talking about getting an extension 2 years in advance and using COVID as the reason why you had to do it without giving Americans a chance to know about it or to comment, that to me is a stretch. All I know is that we have to abide by the law at HHS and at CMS, and we have to be transparent in the way we do it. All we're asking is that Texas participate with us to make sure that that transparency is there.
Okay, so they applied for it under the letter of the law. If they resubmit, can you guarantee that it will be approved? If they resubmit it according to the law as they already did?
If and when Texas resubmits, we will look at that according to the law, and we'll go through the process that provides for notice and comment so we can make sure that we get the input of all stakeholders to make sure that whatever Texas does complies with the law and has the support of those who are going to be impacted.
My last question, you seem to indicate earlier that you actually do not support or do not recognize the statute on partial birth abortions. Can we answer that more clearly now? Yes or no? Do you recognize the statute that outlaws partial birth abortions?
So again, trying to be as clear as I can on this, there are procedures that are used in providing women with the health care they need, including when they have
It's a very clear statute, Mr. Secretary. Please don't waver on this. The Supreme Court has already spoken on this particular statute. Do you recognize it? Yes or no?
Well, I certainly recognize what the Supreme Court has said, and we will abide by what the Supreme Court requires. And we're going to make sure that we protect women's rights to health care.
The gentleman's time has expired. We thank you for his questions. Heal and be well. The chair is now pleased to recognize one of the fine doctors on our subcommittee, Dr. Schreier of Washington State, for 5 minutes.
Thank you so much, Madam Chair, and welcome, Secretary Becerra. Thank you for coming to this committee to talk with us about your priorities in the HHS budget. First, just as a pediatrician, I want to thank you for prioritizing children in so many ways. But I want to talk about something else today. I want to thank the Advanced Research Projects Agency for Health, ARPA-H, to focus on breakthrough research for diseases like cancer, diabetes, and Alzheimer's. We have just witnessed with Operation Warp Speed how quickly medical advances can happen when government targets investment and ameliorates that risk. And this keeps us right on the cutting edge of research and development to treat and cure some of our most devastating and dreaded diseases. Now, I was also especially thrilled to see the investment in the Office of the Assistant Secretary for Preparedness and Response, in ASPR. And I agree that defeating COVID-19 should be our current priority, along with preparedness for the next public health challenge or pandemic. This one has been quite a lesson in preparedness and what we can even do better next time. And I would also suggest that readiness to quickly deploy a robust testing strategy, in addition to shoring up our national stockpile, is critical for this pandemic and for the next one. And depending on how effective the current vaccines remain, right now things are looking good, also depending on how many of us get vaccinated, testing might be able to take a back seat for right now, but that's a big may. And we've all seen how important rapid diagnostics are in containing disease and containing the spread. And we didn't do it well in the US. We really stumbled at first. We never really caught up. We're still not doing surveillance testing even today. And the vaccines are proven to be remarkably effective, but suboptimal public uptake and global circulation means that we're probably going to be living with COVID-19 for a long time. And I just want to make sure that we're using every tool we have. We still need to have a robust testing program for diagnosis and surveillance that includes inexpensive at-home tests that could be manufactured at scale. And we need it now, thinking about schools, and we'll need it for future infectious disease threats. And the coordinated interagency work with the CDD, CDC, the Department of Defense, NIH, FDA, and ASPR is doing to reopen schools and get that testing to market is phenomenal. I want to highlight the work that ASPR has done with BARDA. However, even in their own assessment, they acknowledge that testing still needs to be more widely available, more affordable, and more convenient. So, Secretary Becerra, can you just tell us if you have plans for additional investments in ASPR, BARDA to continue developing and deploying a really sustainable and scalable testing strategy?
Congresswoman, thank you for the question. And listen, I can't agree more with what you've just said. And we discussed, I answered some questions about testing a little earlier. We're not done. Even if we get fully vaccinated, we're not done. We have a lot of work to do because testing, it's the prevention part of dealing with an illness or a crisis. It's trying to avoid it from spreading and becoming the pandemic, the real crisis. And testing will be part of any package that we try to implement to make sure that we're dealing with healthcare crises moving forward. By the way, I would be remiss if I didn't thank you for the work that you've made have done in helping us ensure that we have testing available for Americans throughout the country. And perhaps it's because of your own background and training that you understand that in order to keep people healthy, especially our kids, we want to make sure that we know where the crisis might occur. And so we're going to continue to make investments. ASPR is critical, BARDA is critical, ARPA-H will be just innovative and breakthrough in helping us get there. So I hope we can work with you to make sure that testing is part of any program that we have to protect Americans.
I would love that. I know there was a question earlier about what are we going to do with all this extra money for testing. I can think of a million ways to spend it. And one of them is having tests that cost right now $12 each is our over-the-counter tests. And that's just too much for using on a regular basis. So I could see investing boldly there. I could see deploying testing in elementary schools until we have vaccinations roll out and widely accepted for kids. Last question, you talked about Congress helping. Is there anything that you specifically need from Congress to make surveillance, home testing, scaling up possible?
Aside from the resources, I would tell you your connections. You know the people on the ground in your district who can help us most. Help us connect with them as quickly as possible.
Great, thank you.
The gentlewoman's time has expired. Pleasure to recognize the gentlewoman from Arizona, Ms. Lesko. You have 5 minutes.
Thank you very much, Madam Chair. Before I get to my question, I would like to ask you to get a copy of an article from ABC 15 News in Phoenix for the record. It's entitled Valley Family Pleads with FDA for Access to Experimental Drug for Fatal Children's Disease.
Have that, so you need to submit it.
Thank you. Secretary Becerra, thank you for being here. The FDA's world-class drug
Am I unmuted?
Yeah, you're unmuted.
Ms. Lesko, you need to unmute. Can you hear us?
I think
Yes.
she's frozen. There she is.
There you are.
I am unmuted on my side.
All right, start your question again. Because we didn't hear it.
Madam Chair, I think she's freezing up.
Yeah. Why don't
Okay.
we,
All right. Can you hear me now?
yes, go ahead.
All right, I'm just going to use, I think what's happening is I have my statement and I'm just going to read it. Secretary Becerra, thank you for being here. The FDA's world-class drug approval process ensures medicines do exponentially more good than harm to the American public. But in rare situations, the only option for very ill people is a medicine that is not yet approved by the FDA. These are dealt with under the FDA's compassionate use or extended use program. I want to bring to your attention, sir, Woodrow Miller. He's a constituent of mine who is only 21 months old, and tragically has Niemann-Pick's type C disease. NPC is a rare, progressive, genetic disorder which can begin to show symptoms in children very early in their lives. Symptoms include difficulty moving limbs, an enlarged spleen or liver, a decline in intellect, dementia, seizures, difficulty speaking and swallowing, a loss of muscular functioning, loss of vision or hearing. The one glimmer of happiness in this very tragic prognosis is a medicine that doctors in the field of neurology believe can delay for some children the most impactful symptoms of the disease. Unfortunately, due to a discontinued clinical trial, Woodrow is not able to gain access to the medicine his doctor believes can help him. I have spoken to Woodrow's mother, Denise, and I want to do everything I can to help. Denise has spoken with many doctors. We've got letters from many doctors and Woodrow's doctor. My staff has also spoken with Denise and have been in touch with the FDA staff, both through the phone and email. FDA staff are sympathetic and responsive, but have not found a path forward yet. Last week, I sent a letter to Acting Commissioner Woodcock asking her to review Woodrow's situation and use the authorities at her disposal to help Woodrow quickly gain access to the medicine his doctor recommends. Quite frankly, time is of the essence. I can't stress this enough. NPC is a degenerative disease. Once a child loses functions, it is unlikely he will regain them. Mr. Secretary, will you direct your staff to follow up on the status of FDA's response to my request to help Woodrow gain access to the medicine his doctors believe can help him? And will you emphasize they should use all appropriate options? Thank you, sir.
Congresswoman, first, thank you very much for pointing out what so many Americans unfortunately suffer, and that is the plight of loved ones with these very rare diseases. I am absolutely willing to make sure that I follow up with your request with Acting Commissioner Woodcock. And what I will tell you is what I said to the folks at the FDA recently, and that is that I recognize their independence. They base their actions on science, not on politics and influence. And so I will absolutely communicate your message. I suspect that she and her team are working on it as well, and understand the heartfelt way that you've conveyed that message, and we'll try to get back to you as quickly as we can.
Thank you, Mr. Secretary. I appreciate it. My constituent appreciates it. Anything you could do would be greatly appreciated. And I yield back, Madam Chair.
The gentlewoman yields back. A pleasure to recognize the gentlewoman from Massachusetts, Ms. Trahan, for your 5 minutes of questions. And I want to thank members for staying on time because it looks like we're going to be able to accommodate everyone, including Mr. Doyle. So you're recognized for 5 minutes.
Thank you, Madam Chair. And Mr. Secretary, thank you so much for being here with us today. Your appointment has sent a clear signal that the department will once again prioritize expanding affordable, accessible, high-quality health care for all Americans, including those in our underserved communities. In my district, no one has done more to deliver that quality, affordable care to the underserved and under extremely challenging circumstances than the nurses and doctors and administrators at Lawrence General Hospital in Lawrence, Massachusetts. They serve the 80,000 residents of a beautiful, bustling, diverse, and historic city on the banks of the Merrimack River, the force that powered America's Industrial Revolution. 80% of the city's residents is Latino, and you may remember that the area was struck by a series of natural gas explosions back in September of 2018. You know, just as the city was recovering, the pandemic struck, setting progress back. On a per capita basis, the city has suffered greater numbers of COVID infections than any of our 350 cities and towns in Massachusetts. And at one point, 3/4 of Lawrence General's inpatient capacity was dedicated to recovering COVID-19 patients. Time and again, Lawrence General has come through for the community, particularly the 20% living in poverty. Indeed, approximately 75% of its patient population is public payer, primarily Medicare and Medicaid. Last month I wrote to you along with Senators Warren and Markey asking the department give Lawrence General the highest possible consideration for aid in the fourth tranche of provider relief funds. And your congressional team has been extremely responsive and helpful, but I wanted to personally alert you to this issue given the incredible strain that the pandemic has put on the hospital. The PRF assistance that Lawrence General has received thus far has been instrumental in allowing the hospital to continue operating despite higher costs and lower revenues. However, even with that assistance, the hospital is in a fragile financial position. And I can only imagine this is the case for many safety net hospitals serving similar populations across the country. So, Mr. Secretary, given that the federal relief to the nation's hospitals thus far has significantly helped these facilities to serve on the front lines of the pandemic, does the department plan on relieving hospitals of financial burdens even further through enhanced PRF, relief for advanced Medicare payments, or any other measures?
Congresswoman, first, thank you for the question. But secondly, thank you for the work that you've done on behalf of Lawrence General. We have learned a lot from Lawrence General. And I will tell you that Lawrence General and those safety net hospitals that were out on the front lines deserve our attention. And when it comes to that provider relief fund, it was meant, you all passed that so we could actually address the needs of those providers that stepped up to the plate. And so what I can tell you is that having represented when I was in Congress a number of those safety net hospitals myself, how important it is that we not let them fall through the crack, because they're the ones that were there before we had the pandemic, serving these populations that were very vulnerable. And so I can only commit to you that under my leadership, I hope that you will see that HHS is trying to do right by all those who stepped up to the plate, those safety net providers, and that we're doing the right thing with the provider relief fund. That's why accountability and transparency will be so important as we disperse those final tranches of dollars.
Well, I appreciate your thoughtful answer. On the topic of provider relief, I also just wanted to raise concern regarding inequities in the distribution of the provider relief fund. Assisted living providers who care for nearly 2 million elderly individuals were allocated less than 2% of the provider relief fund and have only received about a third of that. Due to PPE needs, workforce needs, occupancy declines, assisted living caregivers suffered over $15 billion in losses in 2020 alone. Now over half of assisted living facilities nationwide are operating at a loss, and 56% say they won't be able to sustain operations for another year. I recently signed a bipartisan letter asking HHS for a more equitable distribution of the remaining PRF to assisted living facilities. So, Mr. Secretary, how do you envision implementing an equitable distribution to these assisted living providers who need immediate assistance?
Congresswoman, that's a great question, and there's where the transparency that we will ensure is going to be, I hope, our best response there, because there is more need than there is money. And what we have to do is prove to you and others that when we disperse those funds, it's based on real need, that we can be accountable for the dollars that we send out. And so I offer you the chance to continue to work with my team and me as we try to make sure we do right with those provider relief funds.
Terrific. Well, thank you so much, Mr. Secretary. And please consider this an open invitation to come to the Merrimack Valley and meet the wonderful professionals at Lawrence General sometime soon. Thank you, Madam Chair. I yield back.
The gentlewoman yields back. It is a pleasure to recognize Ms. Fletcher from Texas for your 5 minutes of questions. Great
Thank
to see
you so much,
Lizzie.
Chairwoman Eshoo. And Secretary Becerra, thank you for sharing your priorities with us today and your thoughts on the priorities of those on this committee. Unlike so many of my colleagues that I've heard earlier today, I arrived in Congress after you had returned to California to serve as Attorney General. So I'm glad to meet you today this way and very much look forward to working with you. You're taking the reins of HHS at a critical moment in our history, and there's so much work to be done as we emerge from this pandemic and many issues that we've been working to address since before it began. And I want to take my time today to talk about an issue of critical importance in my district in Houston and across the country, the Title X Family Planning Program. I've become fond of reminding people that Title X, which is the only federal program dedicated to family planning and which provides critical preventive health care services for millions of low-income Americans each year, Title X was born in Texas 7. It was introduced in Congress by my predecessor in this seat, then Congressman George H.W. Bush. This program has long had bipartisan support across our community, and it plays a vital role in ensuring access to essential services. Unfortunately, the last administration's actions to impose an ideological domestic gag rule meant that millions lost access to care under this program as thousands of health centers were forced out of the program. 6 states have gone more than a year without any Title X funded health centers. In 2019, 800,000 fewer patients received care under Title X as compared to 2018. And in 2020, the reduction was even greater. So I'm pleased that the administration's budget request enhances the funding for Title X after years of flat funding, so we can restore Title X to its true purpose intended by Congress, to provide preventive health care and family planning services to those who need it the most. I'm interested in better understanding the administration's timeline for implementing changes to the Title X program and when we can expect the quality family planning providers that were shut out of the program under the last administration to be able to once again serve patients. Secretary Becerra, can you discuss the administration's request for additional Title X funding and why this increase in funding is so critical?
Absolutely can, Congresswoman. And I look forward to the opportunity to get to know you better and develop the friendship as I have with many of the members that you sit with. Listen, Title X is crucial. It's family planning. It's preparing our families for a bright future for their kids and them. It's making sure that we do the right thing. And we have to make sure the services are available. It's not just for women. Obviously, mostly women, but it's not just for women. And you may know, I did a lot of work when I was Attorney General to protect Title X and its services. And we're going to fight just as hard. Thank you for what you did to make sure that there was $50 million made available to the ARP so we could make sure family planning services were made available. We're going to do everything we can to restore some of those services. The president's budget increases funding for Title X. It's just the right thing to do. I mean, we can't be about families first if we're not providing them with the services they need to make the right decisions about moving forward with their family. And so I will tell you that working with those of you who are interested, we are going to launch as best we can, as quickly as we can, but we have to make sure we do it right. If we're going to promulgate rules, we have to do it the right way. And we're going to make sure that we do this right so we can service the people who need those family planning services.
Great. Well, thank you so much for that. And I guess one quick follow-up, I would love to work with you on this and would love to know if you can tell us any more now about how you intend to restore the program to ensure that more patients are served.
Again, when we get closer to promulgating those rules, we'll be able to work together. But I don't want to get too far ahead of ourselves because, as I said, we have to make sure we do this the right way.
Okay, well, thank you for that. I appreciate your efforts. Title X is a critical aspect of our healthcare safety net, and millions of patients rely on access to care through this program each year. So I encourage you to address it quickly and look forward to working with you on that and to restoring the program. And with the time I have left, I do want to just touch on an issue that my colleagues from Texas have raised about the administration's withdrawal of its approval of Texas's 1115 waiver extension. As you likely know, Texas is in a healthcare crisis. It has the highest uninsured rate in the country. It is certainly my hope that Texas will expand Medicaid, especially considering the incentives in the American Rescue Plan that we worked on in this committee. But I hope we can work together to address the concerns that have been raised. It is clear that even if Texas were to expand Medicaid, there would still be a need for some form of 1115 waiver to fund any existing uncompensated care in the state. And of course, we hope it will be done in a transparent way and in a way that provides quality care to disadvantaged Texans. So I'm glad to hear that you're working closely with people in Texas now, and I urge you to work with them to accomplish these vitally important objectives to our state. So thank you so much, Secretary Becerra, and with that, I will yield back.
The gentlewoman yields back. I don't see Mr. Schrader, so I'm going to go to Mr. Doyle. who is waving on, and he's been with us since the beginning of the hearing today. So you're recognized, my friend, for 5 minutes.
Well, I want to thank the chair and my good friend for allowing me to wave on to the committee. Mr. Secretary, congratulations. To my friend and former colleague Javier, it's good to see you. It's been too many years, but good to have you back and in this very, very important position. I want to start out with an issue that's a matter of urgency for Pennsylvania and our Medicaid program. On January 8th, the Trump administration put out a regulation around Medicaid managed care contracts that's going to force Pennsylvania to completely redo formulas for how our Medicaid program reimburses hospitals and nursing homes in 2022. This regulation reversed about a decade's worth of approvals for the way Pennsylvania pays our managed care providers. And while CMS believes Pennsylvania can transition to alternative directed payments, our governor, our Secretary of Health, our hospital association, and I are all concerned that this does not fully account for the difficulties, risks, and implications of such an abrupt policy change. In fact, the real timeline only provides our state a few weeks to develop the needed policy changes, since they also need actuarial approval prior to the end of the year. Unfortunately, this scramble puts Medicaid payments to hospitals and nursing homes at risk during a pandemic, which I hope we can all agree is counter to our shared goals. Ultimately, this change could force hospitals and nursing facilities to limit Medicaid beneficiary access if they are faced with funding uncertainty, which does not seem to be in line with President Biden's larger efforts on healthcare. We understand CMS has concerns around current policies. And although we don't completely agree with those concerns, we really believe more time is needed to discuss this and develop a path forward that works for both sides. So my question is, Mr. Secretary, will you commit to working with us on this issue and consider delaying this new guidance for a year?
Congressman, good to see you, and thank you for the question. I know this is of importance to you because I've had several conversations now with Governor Wolf on this particular subject, and we will continue to have those conversations. Our team is now chatting more directly with your folks back in Pennsylvania. You have my commitment that we're going to try to work through this. It's a complicated issue, and I can't even describe it all because I have to have my folks at CMS sit down with me a little bit more, because in my first conversation with Governor Wolf, I was hoping we'd be able to get back to him really quickly because I know that time is of the essence. But what I could commit to you is that we're going to be sitting down with Governor Wolf and his team, and if you'd like your staff as well, to make sure we work through this as best possible.
I appreciate that, and it's really important to us. Let me just ask you one more question too. It's a bit broader question, but something I'm also excited to work with you on. I'm sure you know the rates of antibiotic resistance have been on the rise for some time, and yet we still aren't seeing an active pipeline of new drugs to fight these resistant infections. So my question is, what resources does HHS plan to dedicate to the development of new antibiotics and antimicrobials in the coming year? And has HHS considered shifting the way we pay for antibiotics to ensure a steady stream of new drugs?
Congressman, it's going to be an all of the above approach, because I think everyone's recognizing that we're beginning to lose those defenses against some of these very deadly diseases if we don't tackle this quickly. So we are willing to listen to whatever anyone has to offer. We certainly will take resources as well, because we do want to develop the next generation of antimicrobials so we can be ready. And so we'll be ready on that.
Well, thank you very much, Mr. Secretary. It's good to see you back here in Washington. Madam Chair, I will yield back a minute to you, and thank you for your courtesy.
Thank you. Yes, thank you, Mr. Doyle. Mr. Secretary, let me ask you a quick question. Yes. We have about, I think, 4 minutes left, but we have 2 members that will bring their questions to you in a rapid manner. They've waved on to the committee. Can you stay with us just to accommodate the 2?
It is hard for me to tell friends and colleagues no. So if we can do this quickly, I will
That
stick around.
was the right answer. That was terrific. Music to my ears. All right, so we will go to Mr. McNerney of California for his 5 minutes. And if you can question faster than that, that would be terrific.
Well, thank
You're
you,
recognized.
Chairwoman Eshoo, and thank you, Secretary Becerra. It's great to see you. I think you're doing a great job this afternoon here. I appreciate the administration acknowledges the clear link between climate change and human health. The scientific community has been warning us for years about the consequences of climate change. What I wanted to do is expand upon Congresswoman Blunt Rochester's questions. The administration is requesting funding level increases for the NIH Climate Change and Human Health Program and the CDC Climate and Health Program. These initiatives fund research on the health impacts of climate change and adapt our public responses accordingly. The previous administrations intentionally silenced the scientific community's concerns about climate change. How will you reverse the negative impacts of the prior administration policies?
Congressman, great to see you. And of course, I get a scientific question from a scientist. I will say to you that the fact that we are establishing at the direction of the president, this office that will deal directly with climate change is a clear message of our commitment to deal with climate change as a healthcare, public health issue. And you know my work as AG in California, where we took on this issue, established the Bureau of Environmental Justice. We understand that those who are worst and first hit are usually those vulnerable communities. So we're going to tackle this one because we have no choice if we truly want to have Americans stay healthy.
Well, how will increasing the budget for climate and health effects at NIH and CDC strengthen public health departments and labs in their response to climate change?
Without a doubt. And we'll take whatever resources you can give us because you know there's not enough that we have right now.
Well, we know that climate change affects everyone, but it has disproportionate impacts on low-income and minority communities. From your perspective, how will investing in the NIH and CDC programs reduce these disparities?
You know, as much as California fights to have clean air, if you have a child in the Central Valley, there's a 1 in 4 chance that your child will have asthma. Why? Because of the air quality. And so we have to do everything we can, working with our local partners, working with Congress, to make sure we're addressing this. Congressman McNerney, on this one, you have me at hello to try to do everything we can.
Very good. And as you're aware, you just mentioned the Central Valley in California suffers from some of the worst air quality in the country. This has been made significantly worse by the wildfires. In fact, in the New York Times, an article by Dr. Carrie Nandu suggested that the exposure to wildfire smoke is associated with genetic changes in children's immune cells. This is very disturbing. How can the HHS work with the DOE and the EPA to mitigate and prevent harm like this?
We each have jurisdiction, we each have responsibilities, and we each have reach to make a difference. And hopefully coordinating, we can make a difference faster and further than if we try to do it all by ourselves.
That's great. I look forward to working with you, Secretary, and this is a big issue that affects all of us, but especially in the Central Valley. Thank you. I yield back.
The gentleman yields back, and thank him for yielding back the extra time. And last but not least, the chair recognizes the gentleman, and that's what he is, from New York, Mr. Tonko. You are recognized for questioning. I don't want to say 5 minutes, though, because the secretary has to run. So as quickly as possible.
Thank you, Madam Chair, for your chair. And thank you, Secretary Becerra. Congratulations, and thank you for your leadership in joining us today. I applaud the Department of Health and Human Services with their important step in moving forward with new buprenorphine practice guidelines that will save lives. But I'm concerned, though, that the X waiver itself remains, which means prescribers will have to actively apply for what essentially will be a waiver to the waiver. This will leave an unnecessary barrier in place. Secretary, I appreciate your previous comments that the X waiver requirement should be removed, and we look forward to working with you to accomplish this important goal. So my question is, was HHS limited in its actions it could take regarding fully implementing the X waiver and lifting patient caps?
Congressman, you know this better than anyone. You've worked on it harder than anyone, and you know the answer to that is yes, we were constrained.
So I would like, Madam Chair, to enter for the record a letter supporting urgency in passage of the bipartisan Mainstreaming Addiction Treatment Act is signed by some 120 organizations. And as you know, I'm a proud supporter of the MAD Act, which would fully eliminate the X-waiver requirement and authorize the Secretary of HHS to conduct a national campaign to educate practitioners about the change in law and encourage providers to integrate evidence-based medication-assisted treatment into their practices. So would HHS support congressional action to authorize the Secretary of HHS to conduct a national campaign to do this education and encourage providers to integrate evidence-based medication-assisted treatment into their practices?
Congressman, it's crucial that we expand access. And so what I can tell you is we will absolutely be supportive of any congressional action to help us expand access. How you do it, I'm no longer there. I no longer have a vote. I wish you well as you try to move this forward. I know you've been a champion on this issue, but please help us have expanded access.
Thank you. Thank you. My other issue is the Medicaid reentry, which would empower states to restore Medicaid eligibility for incarcerated individuals up to 30 days before their release to ensure that those transitioning will have immediate access to critical services, including mental health support, addiction and treatment, and COVID testing. Granting the states this ability is a great way to respond to their quality of life and to destroy the statistics out there, which have too many people vulnerable to addiction as they're released. Is the president still committed to this population? And would he be willing to include this provision in his budget?
Congressman, you know the president has been talking about expanding access to healthcare to all. You know he has said it should be a right, not a privilege. And as we move forward with restorative justice to help those who have moved on in life, we certainly would have to make sure we're including them. So I won't speak directly for him, but I can tell you the commitment of this administration is to make sure everyone has access to quality, affordable health care.
Well, thank you. And I just hope you can consider talking to OMB about including the Medicaid reentry in your budget. And with that, I thank you, Madam Chair, for your flexibility. And Mr. Secretary, congratulations on your appointment and look forward to working with you.
The gentleman yields back. The gentleman yields back, and we want to thank the Secretary for his flexibility in accommodating those that just waved on. Mr. Secretary, thank you for a very full part of the day in joining us. We look forward to many other hearings and very importantly, the day-to-day work with members from the subcommittee and others as well. Anyone that tuned into this had a front row seat of how much work has been done on the good news front relative to COVID, but how much more work we have to do on behalf of the American people. And as a former member of the House, there's nothing that kind of raises the ire of members than not getting a direct answer to a direct question. So, pursuant to the committee rules, members have 10 days to submit their additional questions for the record. I will do that and ask you to respond in a really timely fashion, but get to the answer so that we can move down the road of making progress. So we wish you Godspeed with this massive portfolio that you have. Everything that we do and the words that are embedded in the statutes, in the legislation, those are all words that walk into people's lives. And we have confidence that you understand that and have a great regard for it, having been one of the shapers of the words in legislation. Now you are an implementer. So we want to give the best language, put the best language forward, but we will obviously work very hard with you to make sure that there's implementation. So Godspeed and thank you. I thank all the members of the subcommittee, those that waved on. And at this, let me ask the wonderful ranking member, we have 18 documents to submit for the record, and I'd like to request, I have a unanimous consent request that these documents, including Ms. Lasco's, be placed in the record.
There's no objection.
Thank you, Mr. Guthrie. Appreciate that. You're always such a gentleman, a pleasure to work with. So at this time, the subcommittee is adjourned. Thank you, Mr. Secretary.
Thank you.